First, I'm going to call the meeting to order at 9:10 and welcome everybody. Deputy Clerk, could you conduct a roll call?
Yes, good morning. Supervisor Brown? Supervisor Brown?
Here, I'm sorry, I was automatically muted.
Oh, boy, okay. Good morning. Supervisor McCowan? You're muted, Supervisor McCowan. Supervisor, yeah. Hi, good morning. Chair Haschak?
Here.
Supervisor Jurdy?
Here.
And Supervisor Williams?
Here.
Thank you. Good morning.
All right. Sheriff Kendall's not on the call yet. I don't see him, so I will do the Pledge of Allegiance. Okay, could you join me? Okay. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good morning, Sheriff Kendall. Okay.
Good morning.
You know, we received word this morning that there was a death of a firefighter in the Mendocino National Forest fire. And so I'd like to start off the meeting today with a moment of silence for this firefighter who lost his life in the line of duty. Okay. Okay, thank you. Right. So our thoughts and prayers go out to the family and to all the brotherhood and sisterhood of firefighters out there who are risking their lives to make us safe. So thank you very much to all those people. In order to speak via telecomment, one must submit a speaker form online before 8 a.m. the day of the meeting. The link to the telecomment request forms can be found on both the first and last pages of the meeting agenda and on the Board of Supervisors website under Agenda and Minutes and Public Engagement. If you have submitted a telecomment request for either public expression or consent calendar, please call in now. And I'd just like to say that item 5G has been pulled. That is the old Boy Scout Road renaming in Pine Mountain area of Willits. And so that's been pulled at the request of the department to be submitted at a later board meeting date. All right. So with public expression, we have one comment. So is Troil Tognoli on the line?
No, Chair Haschak, she is not.
Okay, so we'll continue on to consent calendar. Yeah. Clerk, has proper notice been established?
Yes, proper notice has been established.
Okay, are there any items to be pulled for separate consideration or comment? Okay, hearing none. Okay. There's no public comment.
Calendar.
What was that?
Move approval of the consent calendar.
Okay, there is no public comment.
Second.
So let's see. Now we have okay, so it's been moved by Supervisor Williams, seconded by Supervisor McCowan, I believe.
Yes.
Okay. And Deputy Clerk, could you do a roll call vote?
Absolutely. Supervisor Jurdy?
Yes.
Supervisor Brown?
Yes.
Supervisor Williams?
Yes.
Supervisor McCowan?
Yes.
And Chair Haschak?
Yes.
The motion carries unanimously.
Okay, thank you. Agenda item 5A, discussion and possible action, including an update associated with the Noble coronavirus COVID-19, including possible direction regarding essential services in Mendocino County, operational preparation and response, and associated countywide economic impacts. The sponsor is the Executive Office. Before we go on to that, I'd just like to say that today is a special day because we are honoring and acknowledging the great work that Dr. Duhan has done for our county for the last, I believe, year and a half. And we really appreciate the last 6, 7, 8 months dealing with the coronavirus. And so thank you, Dr. Duhan, for all your tireless efforts on behalf of Mendocino County. We are going to swear in the new public health officer, Dr. Andrew Coren. But at the same time, Dr. Duhan will be with us as a consultant to the county with her wealth of knowledge and expertise and history of what's gone on so far. So we welcome that and her role as a consultant now to our new to be public health officer. So with that, I'll turn it over to CEO Angelo.
Thank you, Chair Haschak. This morning, we are swearing in our new and incoming Public Health Officer, Dr. Andrew Coren. So, Dr. Coren, please repeat after me. I, state your name, please.
I, Andrew Coren,
Solemnly swear that I will support and defend the Constitution of the United States
solemnly swear that I will support and defend the Constitution of the United States
and the Constitution of the State of California against all enemies,
and the Constitution of the State of California against all enemies,
foreign and domestic,
foreign and domestic,
that I will bear true faith and allegiance
that I will bear true faith and allegiance
to the Constitution of the United States and the Constitution of the State of California,
to the Constitution of the United States and the Constitution of California,
that I take this obligation freely
that I take this obligation freely
without any mental reservation
without any mental reservation
or purpose of evasion,
or purpose of evasion,
that I will well and faithfully discharge the duties upon which I am about to enter.
that I will well and faithfully discharge the duties upon which I am about to enter.
Well, thank you, Dr. Coren, for joining us and for taking this public servant position as our public health officer. I have the oath that I would like you to sign, so we'll go over here, you sign it, and then we'll go on with the COVID update. Thank you.
And Dr. Coren, we'd certainly like to welcome you to Mendocino County. You're a well-known entity, a doctor of many years of service in our county, and come very well regarded by our community, by the medical profession, your colleagues, and so we certainly are thankful that you've been able to join us in Mendocino County to work on the pandemic problems that we have. Okay.
Thank you.
So, Chair Haschak, this morning we will be starting with Dr. Coren giving the health officer update. I do not see Dr. Duhan in our meeting right now. So Dr. Coren will be doing the update. And then we will give an update from the Department Operations Center. We have a behavioral health update from Dr. Janine Miller as well today. And I believe that will be a standing item with the COVID update since we are seeing so many problems within our community, and Dr. Miller has been keeping us apprised of what's happening. We will have a very brief fiscal update from Deputy CEO Darcy Antle, and then our standard item around code enforcement. We have Sheriff Kendall with us, John Martyr, John Burks and Trey Strickland. So we have a pretty good update again for this board. I would like to say what we don't have on here is our outreach and education efforts that I think are certainly worthy of speaking about. And we did receive a project summary from the executive director, Katrina Kesson of the Ukiah Business and Tourism Alliance. As this board and the public know, we have a contract with North Coast Opportunities for different target populations for outreach and education around COVID. And then, of course, we have a contract with the chambers to do the Mask Up Mendo campaign. And I can tell you, I won't go through this, but I can tell you there is a tremendous amount of work being done right now, not only passing out masks, but radio station PSAs that are in English and Spanish, additional social media messaging throughout the cities, and with our partners, community outreach. There's a tremendous amount of work. And what we can do, Chair Hashtag, if this board chooses that we could have the Mask Up Mendo partnership come in at the next COVID update and apprise the board of what they're doing. So at this point, I would like to turn it over to Dr. Corin. Thank you.
Thank you, CEO Angelo, and to the board. I want to go through the statistics as you're used to as part of the health officer's update. I also want to precede that by just saying that I'm perfectly aware of the incredible knock-on effects that are not entirely medical, and I appreciate those. Economic and the isolation of people in their homes to protect the rest of our community. The total number of cases as of last night in Mendocino County was 704. And I want to add to this an appreciation or an understanding that the Hispanic Latinx community is suffering 2/3 of those illnesses. There are 67 people in isolation, 3 people in the hospital. Let me back up a little bit. The total has actually come down from 696. The number in isolation has come down from 83 to 67. There are 3 in the hospital now. There were 2 last time, but there are none in the ICU. 617 people have been released from isolation, and there have been 17 deaths in the county of Mendocino, 5 of whom are from the Latinx community. This week, we were beginning to open up hair salons and barbershops. Dr. Doohan has modified, and the state, according to state requirements, retail shops are open but restricted 25%. Malls are restricted to 25%. Child care units and extracurricular activity groups have been increased from 12 to 14 people plus 2 adults. Remote learning protocols were published this past week by Dr. Doohan. Hospital reporting is on the way. Workplace outbreak protocol has also been written. And I have, of course, been asked a lot about opening wedding venues besides just the religious venues. And lodging is something under consideration. So that's where we are at this point in the epidemic in our county, and I would respectfully ask for any comments or questions.
Well, we can also wait until the end if you're going to be around, Dr. Corin.
Pardon?
What we've been doing is we've been waiting until all the reports and then we ask our questions. So if that's all right with you and you'll be around.
That's fine.
Is that all right?
Yep.
Are you going to be around?
I'm going to be here.
Okay, great. So if we'll hold off on your specific questions. Okay?
Yep.
All right. So is Ms. Emery on the line?
Good morning, Supervisor Haschek. It is my pleasure to report to you today as the DOC manager. I am reporting in addition to the information that Dr. Corin has given you. You've asked us for where the individuals that are currently in isolation and or quarantine are working. We have done extensive research on that matter and have found that we have 12 that are in the home caregiver field. We have 2 that have worked in hotels, 9 in healthcare, 6 that work out of county in various industries. We have 32 in retail, 26 in food service. We have 35 in agriculture. We have 238 under investigation. And our remaining individuals are minors, seniors, and unemployed individuals that we have been able to determine. We continue to work diligently in our efforts to be able to get ahead of this effort and curb the increases that we are seeing. There is some decreases in the last week, which we are happy to see, and we'll continue to track that. However, we at this time are not comfortable to say that that would continue, and that's certainly something that we're watching and closely and working with Dr. Corin in our responses and efforts. Each day changes as we are moving through this event. Additionally, our team has been working on ensuring we have diligent efforts in our case contact and our case investigations. And with the staff that we've had and the increases that we've had, we have been changing some of our processes to be contacting individuals in quarantine in limited times. And so we are contacting them to place them into quarantine. We are contacting them again at our 3-day period for those individuals that are asymptomatic, and then contacting them at the end of their quarantine. This shift in service and work will allow us to better focus our efforts on thorough case investigations and further contact tracing as needed to ensure good support to our community and our efforts to limit the spread of this disease. We've had a lot of discussion over the last week regarding the information, and Dr. Corin could certainly speak to this more, as to those or the discussion regarding the guidance that was released by the the CDC, the Communicable Disease Center, versus the guidance that was released through the California Department of Public Health. And I am happy to say that for Mendocino County, Dr. Corin and Dr. Duhan have both instructed our team to continue in the guidance that is provided by the California Department of Public Health to encourage individuals with close contact to get tested. And so we are continuing in those efforts through our OptumServe and our UCSF testing, and working with our community partners and primary care providers to get individuals tested as needed. We have seen a slight decrease in the number of people that have been testing in our OptumServe site, and so we want to encourage people to continue to use that. It's an excellent resource in our community as we continue to work on our response in this event. We are transitioning through and working very closely with Dr. Corin in his efforts of joining the team, and have had really good successes in the last week in some of his guidance, and feel that we will continue to have a great, strong partnership with our health officers. Both Dr. Corin and Dr. Duhan have been highly supportive in this transition for our staff, and in working with one another, and have been a great asset for our team. So with that, I will go ahead and stop there and turn it over to the next reporter.
All right, thank you. Is Dr. Janine Miller on the line?
Dr. Janine Miller, Behavioral Health Director. And today I'm here to talk a little bit about what we're experiencing within our community. And I want to add that it's not just our community. We're seeing this throughout the state of California, and also pretty nationally what we're seeing. But specifically, I want to focus a little bit on what we're seeing within Mendocino County also. So in looking at mental health and substance use treatment and what we're seeing, most of the studies that are being conducted, there are a lot of studies going on right now to look at the effects of COVID within our communities. And we are seeing about 50% of people are stating that they have been impacted, are now experiencing a mental health condition or a substance use condition due to the COVID pandemic. A lot of people, one of the common things we're hearing people state is that while they may be surviving, they're no longer living. Some of the increases that we're seeing in mental health, we're seeing an increase in anxiety and an increase in depression. That doesn't mean that we're not seeing an increase in other of the mental health conditions that are out there, but these are two that we're really seeing the largest increase in is anxiety and depression. We're also seeing an increase in substance use, and that's coming because people are really not sure how to cope with stress and the emotions related to the COVID pandemic. So we're seeing an increase in substance use. We know there was an increase in alcohol sales, and we're seeing an increase in just substance use across every area. We're also seeing, unfortunately, an increase in reported suicidal ideation. That has probably, when you look at those reporting suicidal ideation and even looking at some of the statistics out there in the studies, we're seeing about double the amount of people having suicidal ideation throughout different communities and even within our local community. There's a lot of talk, and we are kind of talking about it here, that we really are going to be experiencing, if we're not already, a mental health epidemic related to the COVID pandemic, just due to what everyone is experiencing. In Mendocino County, we've been tracking our suicide rates, and one of the things we've noticed since COVID started, an increase in our suicides. We average about 20, give or take, a year. We've had a couple higher years, a couple lower years, but when we look at 2019, with the final count of having 23 suicides for the whole calendar year for 2019, while that is high, we always hope to have 0. In 2020, just through July 31st, we have already had 23. So we are at the number we had for the full calendar last year. And I know of at least 3 that have happened in August. So our numbers are definitely increased this fiscal year. And we definitely know that the pandemic is correlated, that the suicides are correlated to the pandemic. And we know that we need to do something different. We are seeing behavioral health needs throughout the community. One of the things we're doing in behavioral health right now, besides having our normal services, and normal services haven't decreased, we've had to adapt to doing more telehealth models, but we still have some face-to-face services. We've moved more to a telehealth model. Services are still being used. We did see a slight decrease in crisis services when the pandemic first started, being that people were afraid to go to the hospitals or afraid to go in to get services. But we've seen that start to increase, and we're now probably about average a little bit higher in our crisis services. Our other services are still about where they have been. We're still providing services, and people are accessing those services specifically for the specialty mental health side of services. We are moving forward. September is Suicide Prevention Week along with Recovery Month. So from this point, we're moving forward to really start doing a campaign on reach out and ask the question, with asking the question, are you suicidal? We need to get people comfortable with asking the question. There's a lot of stigma related to suicide and a lot of stigma with asking the question. So we really are moving forward with a campaign of reach out and ask the question of are you suicidal and know the signs. And so you're going to see that throughout the community. We will be putting that on 2 billboards, one on Highway 20 and one somewhere in the Ukiah area, to really start getting that information out, which will have information on phone numbers, know what the signs are, and more information on really pushing that we get people to ask the question. We also are going to be putting some support groups in place. We've had a lot of people saying they feel unsupported, they need some additional resources. How do they start building connections again when they're not able to get out there and socialize? There's so much feeling of anxiety, depression, and isolation. So we're going to start some support groups that will be available to the whole community. Those support groups are being developed. We've got a portion of them developed. We will have those in both English, Spanish, and we will have a couple First Nation groups also that will be conducted by our staff. So we really are trying to make sure we bring these groups, and we also bring the cultural piece to these groups. So we will make sure that that's included, and we're addressing our community as a whole with those groups. And we will have that information posted on our website. And we also created some social media platforms that we didn't have in behavioral health, but being that there's a need and a lot of push from people saying we need a better way to access behavioral health and what they're doing, we now have a Facebook, a Twitter, an Instagram account. And we will make sure that all resources that are available to our community gets placed on those social media areas, and that we're continuing to update and provide some additional support. Our warm line is still up and active. We are getting calls regularly. Our highest day for calls is Friday, and we have some new callers, and we have some consistent callers that call regularly because they found the line to be very supportive and call once a week to get that additional support to deal with isolation, anxiety, depression, or whatever else they might need for the week. The last thing I wanted to touch on, one of the things we're seeing in our community is that there is stigma related to COVID, and there's a lot of fear of people acknowledging that they have a family member or someone who might have been exposed to COVID and had a positive test. So we are also going to be working with just trying to do what are some different stigma, discrimination things we can put into place. We know that happens with mental illness a lot, and we're now seeing it very consistent with people that are experiencing that because they had a COVID positive case test. So we're definitely looking at how to reduce some of the stigma that's related to COVID so that people aren't afraid. And we've been hearing people actually say they are afraid to acknowledge they had COVID because of the stigma associated with it. So another piece that's playing into people's mental health overall. And so we're going to be really focusing on that. So thank you so much, and I will hand it off to the next presenter.
All right. Thank you, Dr. Miller. Is Deputy CEO Darcy Antle on the line?
Good morning, Chair Hashak, members of the board, CEO. Good morning, Chair Hashak, members of the board, CEO Angelo. I just have a brief update this morning. The finance team, which includes the disaster recovery team and the public health fiscal team, continue to track and monitor expenses and staff time. We also continue our efforts to search for grants with our amazing grant writer, Jordan Blau from Laco Associates. Today, the COVID staff hours are trending down. The staff hours that were reported March through June averaged 13,000 hours per month. In July and August, we are averaging 9,000 per hours, with the most of that coming from the Public Health Department, Social Services, the Sheriff's Office, and the Executive Office. With regards to the coronavirus relief funds, we are submitting that plan this week. The information and access to that portal just came out yesterday. I reviewed the plan again with my team this morning. They are reviewing those documents and vetting it this morning while I'm here with you all. We continue to work with FEMA, who regularly changes their processes through the grants portal. And that's been a challenge in the last week or so for myself to figure out. And again, we continue to utilize and look at the best resources we can use to access and utilize these funds to the best of our ability to keep the county as whole as we can. On another note, I'd like to briefly report that the disaster recovery received an award notice this week for ignition resistant construction. This is phase 1. If you remember, we submitted for this grant in December of 2018 to help with the 2017 relief. So we continue to work on the 2017 fire, as well as very active in this 2020 COVID pandemic. Thank you. That concludes my report.
Okay, thank you. Okay, we're moving on to code enforcement and Sheriff Kendall. Good morning.
Good morning. Chair Hashak, members of the board. I met with our coastal commander yesterday afternoon in Mendocino. Our calls for service regarding violations of the masking ordinance, as well as violations of the order itself, are way down. His estimate is under 10 for the last 2 weeks. That does not include just the routine contacts where if we stop a person in a car, we're providing them with some education, especially if they're from out of the area. However, I think that that's a very good sign, because a lot of the outreach and the things that the CEO's office has been working towards with the several of the chambers and whatnot are having a good effect. And I'm just generally looking at the numbers of things going on over the last couple of weeks. I believe that we've made a lot of headway on this, and it's really taking and having some good effect. Thank you.
Okay, thank you. Is John Martyr from Special Investigation Units?
Good morning, Chair Hashek. John Martyr, Chief Investigator for the Special Investigations Unit. For the last 2-week period since the last board meeting, we've had 10 calls for service, which is down from 18 on the prior 2-week period of time. We also had 8 days where we had no calls for service. So I echo what Sheriff Kendall said, that the trend seems to be downward in terms of calls. We had 4 calls related to gatherings. We had 7 masking calls. Most of the masking calls involved employees of businesses not wearing their masks, as opposed to general citizens being unmasked. We also had an incident that was on video from our Costco retailer about some people that were not masked. In cooperation with the Ukiah Police Department, SIU investigators investigated this incident, and we closed that out with issuing 2 citations for masking violation on that. And I just want to add that the Costco management was extremely helpful to us in our investigation. For this upcoming Labor Day weekend, I have been working and networking with the various city law enforcement agencies, as well as the Sheriff's Department. We're going to have 2 investigators assigned Friday, Saturday, Sunday, and I believe 2 on Monday as well. We will be out patrolling and enforcing our public health order. And that concludes my report. Thank you very much.
All right, thank you. Is John Burks available?
Yes, good morning, Chair, Board, and Community. This is John Burks, Code Enforcement Supervisor. Since my last report, we've only had 1 new complaint requiring an investigation. So again, that's down, just like most of everyone's reporting, it seems. These are the following changes to my status report. We have 2 active cases. Both are working on compliance. I have confidence that those will be closed shortly. We have 1 case in citation. So that brings us to 106 investigations closed with compliance. With that reduction of the health order violation complaints, your code enforcement team is working on clearing the backlog of cannabis and traditional complaints now. So we're taking this opportunity to kind of catch up and see where it goes from here. So thank you for allowing me to be of service.
Okay, very good. Thank you. And Trey Strickland from Environmental Health.
Thank you, Chair Haschak, board members, CEO Angelo. This is Trey Strickland, Environmental Health Director. Environmental Health is continuing to provide support as needed, transporting samples, test kits, PPE, responding to complaints and issues referred to us from the call center. And we've also developed a protocol to respond to business outbreaks. That's where they have 3 or more connected cases. And the protocol is a fluid document. It'll be revised over time as more information becomes available. I'm happy to answer any questions anyone has.
Okay, thank you. So now we'll open it up to any board questions or comments. So we'll start with Supervisor Jurdy.
Yeah, thank you. People went through some statistics pretty quickly, and so I didn't capture all of them. Can people who gave reports maybe just either upload them or email them to the board so we have those? For example, the number of hours, Darcy, you said dropped from, I think it was 13,000 hours a month in April through June, down to 9,000 in July and August for COVID-related work. That was an example. And then Janine, you said that 50% of the population is experiencing mental health issues or substance abuse issues. Is that of the entire county population, and that's an estimate, or is that of a subset of the county population?
So this is Dr. Miller. That is based on studies that are being done across the United States. So when we look at different studies, that people are 50% of people that are being studied are reporting an increase of mental and behavioral health conditions, symptoms due to the pandemic. I would say we have not done an internal study to really look statistically at our population, but we can say that based on the information we have, that we have an increase of population reporting mental health conditions or behavioral health conditions based on the COVID pandemic. It really, we are seeing an anxiety, depression, and loneliness and isolation. And that's pretty consistently reported with any of the population we are currently serving.
Okay, so if that's a national statistic or estimate, are you seeing recommendations coming from the Department of Public Health or other, say the state of California on how local governments are helping to address that?
The recommendation is to increase services. So what they're really doing is trying to figure out how do we increase services. And one of the, as you know, since the county really focuses on especially mental health, and we have to work with a partnership health plan and private insurance plans to offer alternative services than they currently do. One of the struggles we're finding is that, there is no parity across insurance plans. So while you may have especially mental health, bringing a lot more services into your communities, they're not seeing that consistently across insurance companies. And so the recommendation is really to be a push for parity and to see that all insurance companies are really providing more options for mental health treatment. While that is not consistent today, that is sort of the push. One of the reasons we're bringing these support groups forward is to offer a free service that can actually be available to everyone in our community, regardless of their insurance, to provide something they're not currently getting by their private insurance companies.
Okay, then finally, these studies you're referring to, are they identifying the stress primarily financial, or is it the isolation, or is it just the combination of the two?
Depending on what study you look at, it's a little different, but I would say it's really the combination of the two. Obviously, the economic downturn has hit people. We know that not every time there is an economic downturn, we see an increase in mental health symptoms. This is more severe than we normally see. The pandemic piece of it, the isolation, the anxiety, the depression that's coming with the loneliness and isolation, the fact that we consistently hear people really say, we may be surviving, we're no longer living. We've really taken away people's lives, how they see it. What they normally did has really changed. So it's really hard. People don't cope well to change. We know that change is one of the top stressors. So we're really seeing that the pandemic as a whole is impacting people. And I do believe that it's both the isolation, the loneliness that creates that, and the economic downturn.
Okay, thanks.
All right, thank you. And I appreciate you keeping it to a couple questions. We'll go around 2 questions each. Supervisor Williams.
I think this question is to my colleagues. I would like to know where you all stand. I fully supported the initial shutdown. We didn't know what was happening. We didn't know how bad it would be. We have a government that wasn't prepared for a pandemic. I think it was appropriate. And I still support modifications to business practices to ensure safety. Asking business to wear facial coverings is like asking restaurant workers to wash their hands before leaving the restroom. But when we start getting into shutting down sectors, telling a business sector that they cannot work, even where it's 2 consenting adults, a business operator and 1 customer in a premise, we're saying even with masks, they cannot legally operate that business. It needs to be backed by findings. We need to show that healthcare is overwhelmed or will become overwhelmed, and this particular type of business is in fact causing the increased risk. It's causing cases. And what I see is, this is not the county, this is the state of California, is indiscriminately targeting certain industries, which perhaps in an urban area are creating cases, but are not demonstrated to have created cases in our county. And to me, that starts looking like a regulatory taking. We're telling them, even though they haven't been the proximate cause of an increase in cases, and even though our hospitals are nowhere near overwhelmed, we're going to shut them down. We don't know for how long, until social gatherings stop creating cases. So as one supervisor, I'm less and less comfortable with this, and I'm not comfortable seeing it reflected in our county order. I understand that we can't be less restrictive than the state, but and the state's order is so vague that we feel that we need to include the same restrictions to offer clarifying language. I don't know. I would rather not see it in our order and just reference the state and send the state a message that this one size fits all doesn't work. And we've been highlighting this for months, and we're moving to a model of surgical restrictions that are targeted based on data. I don't see that data from the state. I don't see data to show that nails in Mendocino County are causing the increase. In fact, we see social gatherings and a whole lot of other reasons as contributing factors. And while nails don't seem like an essential function, you could shut that down. Imagine if you're the business owner and you're a sole proprietor, you're trying to feed your kids and you're told you're not allowed to work anymore. That's harsh if there isn't data to back the restriction. So I guess I'd like to hear where my colleagues stand on this, and maybe from public health about, is it possible for us to, at least at a county level, target restrictions based on the increase in cases we see out of the sectors?
And I'd just like to say thank you, Supervisor Williams, for helping with that letter that we sent to the state, California Department of Public Health, about salons and barbershops and trying to get more leniency. That was in the old model of being on the watch list. And now that we're in the new model, my understanding is that those are open.
Many of those industries are still closed. I mean, you can cut hair with modifications, but you can't do lashes. Well, why? Where's the data? And I want to last point, our restrictions are now driving an underground economy. Prohibition is removing our ability to regulate business, because I see wedding planners are on social media with secret locations to hold events. And all sorts of personal care services are happening below the radar. And I think we're setting ourselves up for a greater risk by driving people into an underground economy. You tell people they can't work for half a year, eventually they're going to find a way to work. They need to buy food for their kids. I would rather be saying, hey, if you're going to do this, you need to wear a mask. We will shut your business down if you don't follow safety precautions. But to drive them into an underground economy is not benefiting anyone.
Say, County Council. So Supervisor Williams, your questions were directed towards...
I'd like to hear from my colleagues and public health, and I suppose county council in regards to, could we reference the state order? We don't have the authority to negate it, but we also don't need to be copying the same restrictions.
Okay, any comments from other supervisors, or should we go to our new public health officer and county council?
Chair Haschak?
Yes, Supervisor Brown.
Thank you. Supervisor Williams, that is the debate going on now, not only here among us, but statewide as well as nationally. Just exactly your statements. That's all I have to say.
Okay.
Mr. Chair?
Yes, Supervisor McCowan.
Thank you. Well, I agree completely with Supervisor Williams. The governor tossed out a small bone for small businesses, by opening up hair salons and barbershops. And yet there are other professions that hold the same cosmetology license, have the equivalent training, and yet they are prohibited from opening. And the situation that we're faced with in Mendocino County is, with our current case rate, unless we have some sort of dramatic breakthrough in reducing cases, it's very foreseeable that we will have that we will not be able to move to a lower tier for weeks, perhaps 6 weeks or more, who knows. And then once we are able to move to a lower tier, we have to stay there 3 weeks before we can go to the next tier, another 3 weeks, and then 3 weeks to go to the final tier. This is untenable for our businesses. We know that many have closed already, and the concern is that with every passing week, more will close. And we see this, the trauma of this reflected in the experience with mental health. And I've been both reading the emails, I think we've all been reading the emails that business owners send in to us. I've also been seeing a lot of the comments on social media, and I'm literally seeing people deteriorate before my eyes as they keep hoping they're going to be able to open. The greatest thing to restore mental health would be to have people go back to work. So to that end, I would encourage us as a board, and ideally our health officer, to be advocates for the state to recognize that one size does not fit all. This is one size fits all on steroids. There's no variation allowed. We're all governed by this same very rigid construct that they have developed. And I would advocate that we urge the governor to empower our local health officer to make decisions regarding business restrictions or business openings based on our local experience. The state proclaims, and the governor proclaimed when he rolled out his new blueprint, that data and science are our North Star. But I would echo Supervisor Williams, where is the data? Where is the science? Because our experience in Mendocino County is that the increase in caseload has not been driven by business activity. It has been driven by social gatherings, families, community gatherings. We are very aware, of course, the unfortunate situation with a skilled nursing facility. We seem to have gotten past that. So it's primarily gatherings. So shutting down nail salons, severely restricting the ability of restaurants to operate, gyms and fitness centers actually impairs health. I went by one restaurant a couple of nights ago. It happens to have a good setup for outside dining, but you could scarcely see the people at the other end for the smoke and the heat, and how is that promoting public health? So I apologize for going on at such length. I do have a memo to the board that I did submit, and a draft letter that I hope the board would consider. And it is along the lines of what Supervisor Williams has been advocating for, I believe. So I would encourage us to take a look at that letter as we have a chance to do so, and discuss whether as a board we want to send that letter to the governor. Because otherwise we can anticipate that I don't know, dozens, scores, perhaps hundreds of additional businesses will close their doors in Mendocino County if nothing changes. Thank you.
Right. Any other comments from the board before we go to our public health officer?
Yeah, I have one. I appreciate Supervisor McCowan taking the initiative to write this memo. I would like to get feedback from public health. I think it's important that we work in unity here. But I think he raises the right concerns. I do support it, subject to public health.
Clarification, the memo is to the board. There's another attachment that is a proposed draft letter.
Understood. I support both.
All right, Dr. Corin.
Thank you, Chairman Hashak. And the concerns that everybody is raising are very appropriate. This is a terrible time in our nation, in our world's, in our county's history, and there are many, many, many people suffering because of it. I think it's important to understand that when this outbreak occurred, we had very little information, but tens of thousands of people began to die. And we needed expert opinion, and we needed advice, and we needed a unified response in order to get the kind of turnaround in the death rate that we're just beginning to see now. And in our county, we had a surge over the summer, and it does look, as we approach the Labor Day weekend, like it's decreasing. And my heart goes out to the people, the men and women who are running businesses that can't run the businesses and they don't have the income, and they're suffering socially, and their families are suffering, and so on. But we also have to look at the people who have been hospitalized, who have been quarantined, who have been isolated, and who died. And it's hard to put a price tag, and it's hard to, compare those two. Our county, if we were to now say I were the only one responsible for setting these rules, our county would not have access to the kind of expert opinion, data, and research, and a manner to observe what's going on that would inform my opinions. So my opinions would be one person's opinion, albeit with a new, title, and opposing many of the other people who are definitely suffering from the orders that have been given, by this mandate and by the Department of Public Health. So although I haven't completely digested the letter at this point, and frankly, I haven't completely digested all of the sectors of the economy in Mendocino and how it's affecting them, and I do think that there are differences in a small county than in a large county, but I can't support giving me total responsibility on the basis of we don't have the research. Well, we don't have the research. We rely on expert opinion because they have research, and it takes a lot of time and a lot of money to generate valuable research. Otherwise, you base your decisions on anecdotes. And an anecdote in one area may be totally different than the experience in an entire area. So do we want to err on the side of opening up? Because in our county, we've thankfully brought things under control in the last week or so, not under control, but better control. And if we open up, will we have another surge by the end of September and have to shut down even more? I think the tiered system that you've referred to, and actually I left it out of my report, but the new tiered system that's just come into play from the the California Department of Public Health, is a way to gradually, and I think the state and the state scientists are realizing that we have begun to get this under control, most probably, and we need to have a gradual way to open up our industries and our schools and so on and so forth, because of all of the knock-on effects from trying to protect lives. And so we're now not just in the purple, the worst place that the California Department of Public Health has divided and put us in, but we're way up in the purple zone. We need to come down quite a bit more before we're in the pink and the orange and the yellow zone. And I think risking that, although I'm tempted, I was on the phone yesterday with with the very, very decent, very committed people of the lodgings industry. And they were explaining to me exactly how they booked their rooms and what this order meant for them and couldn't we do more. And we will take that under consideration. You're right, we haven't seen an explosion of cases, but it takes some time to do that. The tiered plan, and we can complain that it takes so long to go from one tier to the other, is a way to open. The initial restrictions were a way to save lives. And we have to keep the perspective clear on this. Yes, as a result, there have been people who've suffered. There's no question about that. But there are people, and still are people, who are suffering without any restrictions. And if we quickly go back, we won't be able to see what the effect of each step as we open up will have. And we may be surprised. You know, so although I appreciate it, I'd be the first in line to want clear, unassailable research. At this point, we go with the research that there is and the expert opinion about how to modify it for a state, for a county, for an industry. And there's a lot of good brains who are working on it at the state level that we don't simply have here. And I can't generate a report of what's happening in the lodgings industry or what's happening or could happen can we do here. So, and neither can the state or the feds. And that's why we're saying, well, let's take it down step by step. We did have some success in changing where we were in March, April, May, June to where we are now. Let's keep going. And so what I would just say is, let's keep going. I know this is painful. I know it's painful on many, many fronts. But we don't want more and more lives in Mendocino to be lost. We don't want families to have to go through that suffering. So we need to be patient. And I would ask for the board to support the recommendations. And let's go a little longer, and if into the fall when the flu season hits, and I know this smoke, this I was saying on the media event on Friday, the smoke does accentuate the effect of COVID. There's no question about it. As we get out of this season, if we go slowly, I'd like to see a success over the next 6 months, and we can be more to a normal life. You know, for the people who are having terrible mental health problems, for those who are having problems with just supporting their families because their businesses are going under, we need to think about supporting them as a community. But we don't want to ignore what this terrible virus is doing to them and the rest of our community. So I'm not sure that that's a specific response, but again, this is a terrible, terrible event. Before I took this job and when I was asked to be this, I read a long book on the epidemic, the flu epidemic of 1918, 1990. Now, they were, you know, in the midst of a world war, and there were people getting together in encampments and going across on boats. But we have to remember that there were millions of people who died. And we could be in a situation like that that's just slowed down now because of our attention to it. And I would just say we have to keep in mind, you know, the potential for suffering, and that maybe we've dodged a bullet. And maybe we don't realize that we've dodged a bullet early enough. But I would like to give us a little bit of time to work with the California Department of Public Health on their opening plan.
Well, thank you, Dr. Coren. I appreciate those words, and really it makes a lot of sense what you're saying, you know, that the research for the industries has been done, you know, at the state level. We do have a situation where we are in the purple, you know, most stringent zone right now. And we're in that purple because of the number of positive cases, average positive cases per day. That's over 7, and ours is what, 10, 11, something like that. You know, I guess that I agree with you in that we've seen what's happened when states open up too soon. We've seen it in Georgia, we've seen it in Florida, we've seen it in Texas, Arizona, those places. And certainly, you know, we had the same discussion early on when we had 1 or 2 cases in our county. And now we're seeing that we're having, you know, we've got over 700, and we're having over 10 per day on the average. So, you know, we have schools closed doing distance learning for a reason, because people are afraid of sending their kids to school. We haven't seen any cases yet of, kids or schools spreading the coronavirus. But we know that if kids get together, that's what's going to happen. And so I go with Dr. Corin and your belief, and let's stay the course. Let's do what's right. I haven't seen Supervisor McCowan's memo yet, and I think that these kind of things should be discussed with the public too. Right. Does County Council have anything to add to that?
Yes, thank you, Mr. Chair. So just to add just a little bit, I think there's really a couple of issues here. One is really the extent of the state regulations, which I think is in many ways the issue that the board has some more concern with, and I think that Dr. Corin spoke to quite ably. I would just want to address that with respect to the local regulations. There are just a couple of things that I'd like to touch on, one of which is that there are a few areas in the local regulations where Dr. Duhan had wanted to go a little bit more restrictive than the state. The caps on the lodging are one example of that. Limitations on specifically commercial wedding venues. And another example would be Dr. Duhan chose to go ahead and move the county onto the watch list restrictions when the data started to go in that direction instead of waiting for the state. And that actually ended up being a bit of a longer amount of time than initially anticipated because of the state's data backlog. In fact, when they went back and retroactively added us to the watch list, they retroactively added us the day after Dr. Duhan's orders came out. So it really ended up covering primarily the period of backlog there. So I have not had a chance to go over with Dr. Corin yet what he's going to want to do on that. I know he's had a chance to speak to Dr. Duhan a little bit, but really that's a determination that's going to have to be made by our new health officer as to whether in those specific areas where the county is a little bit more restrictive than the state, whether he's going to want to keep those or modify those in some way. The other thing is that Supervisor Williams had alluded to this question about the approach that many other counties have taken, where they've simply not had a local order and relied entirely on the state orders. There are pros and cons to that approach, and I will mention, particularly early on in this, one of the things that we saw was that there were a large number of questions coming in regarding interpretations of orders, how are things done, et cetera. I understand, or what was allowed, what was not allowed, what certain industries would fall under. And there are a number of areas of significant ambiguities. One of the things that we had done in our approach was to essentially modify and update the local orders so that they were mirroring the state orders, so that Dr. Duhan would have the ability to provide some definition, be able to answer some of those questions, because we understand that the state had been sort of very slow to respond and somewhat difficult to get some clarity on a number of points. And this was really intended to try and help the industries be able to move forward with some confidence and some certainty, at least as to what the local orders were saying. And if the state wasn't going to specifically take issue with the local orders, we believe them to be in conformity with the state orders. And there were some discussions between Dr. Duhan and the state on some of those, but ultimately the state ended up agreeing that the local orders were in compliance with the state orders. I will say that's the benefit of that, I think, is something that's worth sort of continually assessing. I do understand that we've had fewer questions coming in on some of those areas of ambiguity. That is something I would like to discuss with Dr. Corin as to whether he wants to continue that approach, whether he wants to modify that approach. I think that's pretty legitimate question to be asking as to whether that's going to be the most effective. But I did just want to clarify that was something that was done to try and provide some additional certainty and not sort of leave the local businesses in the situation that I'd heard some other counties having challenges with, specifically where they didn't have any ability to explain the state orders. The state wasn't particularly explaining the orders, and the businesses were left in a state of sort of confusion and frustration. Thank you.
All right. Any other comment on this?
Yes,
my
Mr.
questions
Chair, I
also
do have
answered about
additional
driving.
comments.
Okay,
Oh,
let's.
did I hear Supervisor Williams? I'll defer.
I apologize, Super McAllen. I think it's just Zoom. An unanswered question I had is, what about driving the underground economy? Every service that we've prohibited, best I can tell, is available. I could get my nails done today. And so I think we need to ask the state for the research. And I agree. The state has the resources to research in a way that this county cannot. But I think given that we're in a position of taking the blame and enforcing the state's rules, we are in a position to ask for the state's data. So because I imagine all four of my colleagues are in a similar predicament of you have businesses coming to you asking, why am I closed? I don't have an answer because the state says so. There must be some data somewhere. I think it's time, we're half a year in. We need to ask for that data so that we can at least explain the state's position.
Okay, Supervisor McCowan.
Thank you, Mr. Chair. I have reached out to a liaison to the governor's office. We've all gotten emails from the same gentleman. And I've asked him, what is the data? What is the science that this is based on? Could you provide that, please? And we'll see if there's a response to that. But, and Dr. Koren, there are certainly at least two sides to every story, and you've taken a side that is very protective of, we want to do everything we can to minimize the number of people who may die of COVID. But it doesn't seem to me, it doesn't seem that we are striking a fair balance between protecting public health from COVID and protecting public health from the negative impacts of the response to COVID. And there is no documentation that I'm aware of that shows that we will save one additional life by closing down the business sectors that are currently closed. Also, if you read my letter, you'll see that I'm not suggesting that Dr. Koren go off on his own. In fact, in the first paragraph, I say that we respectfully suggest that our local public health officer, in consultation with California Department of Public Health staff, is uniquely qualified to make case-specific decisions based on local data and experience to impose greater or lesser restrictions than those mandated by the state. So I'm suggesting a collaborative effort, which the state previously has held out to us on numerous occasions, including with the watch list process. That involved intensive collaboration with the state to assist us in bringing our case numbers down. But to do that, you have to know what is causing the cases. In Mendocino County, we have been consistently told for several months now that it is primarily family and community gatherings. It is not people going into a nail salon, going into a restaurant, going into a gym or a fitness center. I would encourage you, Dr. Koren, to have some Zoom meetings with members of these different business sectors. They have done everything imaginable to follow every safety protocol suggested by the state and have come up with many of their own. They tend to be very responsible people. And to say that well, let's see how things look in 6 months, and maybe we'll be in really good shape. That would thoroughly decimate our local business community. I believe it would be unconscionable. And I would like to take us back to where we were in March, and this is recounted in the letter. But in March, we were told what we had to prepare for with modifications. We would still have 40% of our population, 36,000 people, fall ill. 3,600 would be hospitalized, 1,800 in ICU, and 450 would die. And the only question, do you want to see this happen in a month or two, or stretch it out over a year so that we don't overwhelm our healthcare system, hopefully? So obviously the numbers have never come anywhere near that. To have 3,600 people become ill in a year's time would be 100 per day. So we're nowhere near that. We geared up for something that has not occurred, thankfully, and yet we're still punishing the local business community. And I would say also we need to look at our healthcare system. And Jason Wells has assured us on numerous occasions they can easily surge up to 100 beds, 200 beds, or more, depending on the COVID-related demand. So there's no threat whatsoever to our healthcare system. Every death is a tragedy. Every death is unfortunate. But these deaths are not tied to the businesses that we are preventing from opening, and in fact, that we are driving out of business. And I do maintain that it's the overly restrictive approach to COVID that is actually endangering lives. When we hear that all of last year, 23 people committed suicide in Mendocino County, and that's a little above the average. And through July 31st of this year, we already had 23 suicides. And if you talk to law enforcement, the rate of violent crime shooting up, domestic violence, opioid overdoses, we're dying of the cure. And this letter would be a modest first step to reach out to the governor. And it does ask in here, provide the data and the science. No one on this board advocates opening in a risky or dangerous situation, but we are imposing a far greater burden on our community by shutting down without having the data to support it. So with all due respect, I do support sending this letter, and I look forward to hearing from the rest of my colleagues on this matter. Thank you.
Okay, Supervisor Brown, do you have any comments about or questions to any of the speakers?
Not at this time. Thank you.
All right. So with that, we'll open it up to, if there's no more comments from the board, we'll open it up to public comment. And seeing none on our list, we'll go back to the board.
Yeah, excuse me, Chair. So I've had a chance to read Supervisor McCowan's draft letter. Nothing's jumping out as being, inaccurate or inflammatory. I think it's, seems to be an appropriate letter for the board, but, I realize that not everyone on the board may have had a chance to read it thoroughly before today's meeting, but it seems like we could have, say, one or two other supervisors go over it and send it off modified if needed. But I do think that, it is appropriate for the board to be in correspondence with the governor's office, because so much of what we're seeing here in California is under the direction of the state.
Okay, and with that, we need a break right now. So So we'll come back and we'll continue this discussion at 10:39. All right. call the meeting back to order. And let's see, we were discussing this memo that Supervisor McCowan wrote. So we heard from our public health officer. We heard from county council. So are there any further questions or comments from the board? Okay, hearing none. Okay, is there any action that the board wants to take?
My suggestion would be that we either send the letter as drafted by Supervisor McCowan, or if there's two supervisors who wish to redraft it or amend it in some way, that we would designate them to review it and amend it before sending it off.
Chair Haschak, I think we're all trying to set a course to reduce suffering related to the pandemic, both from the virus and from unanticipated consequences. I think the letter is a good move, but I would like it to be with the support of public health. And if that means it needs to come back later today after there's been a greater review, I think we could approve it later. But I'm a little bit hesitant without public health supporting it because our public health officer needs to work with counterparts throughout the state. And I think that'll be facilitated by working in unity with the board.
I'm in agreement with that, and I don't know if we can do it today, but I think that our new public health officer certainly spoke eloquently about this, and I don't think it's a good precedent to put him into this position first day, first report to the board, and I would like to work with him and see what we can do, see what the best approach is.
Mr. Chair.
Supervisor McCowan.
Thank you. I certainly agree that the ideal is that the board and our public health officer are in sync on this. It is a critical issue. And I apologize for submitting the letter late. I think we kind of know I often work at the last minute. In fact, I stayed up all night working on this and other things. So I appreciate Supervisor Jurdy's comments. It's not an inflammatory letter. Much of it is very matter of fact. And the fact is, we prepared for a surge 10 times greater than anything that we've experienced yet. Not only did we have those projections in March based on the modeling that we paid for, more recently, based on modeling, we were told that by the end of August, we would have 53 people hospitalized. In fact, on August 31st, as Dr. Koren has said, and as I had also checked with the hospital, we had only 3 patients hospitalized, none on ventilators, none in ICU. And so despite the surge of cases that we've had, our healthcare system is in no danger whatsoever of being unable to respond appropriately. And B, there is no documentation that closing businesses to the point of forcing them under and out of business, no documentation that shuttering these businesses is protecting public health, because there's no documentation that the businesses have been the cause of the surge in cases. In fact, the evidence, the data is to the contrary. I appreciate the suggestion by Supervisor Williams of perhaps we could come back to this later. Perhaps the health officer could have the opportunity to review the letter in detail, and perhaps we can have a meeting of the minds later. But Before we leave this item, I would like to raise one other item, if I may. We have a couple of letters, one submitted by Roseanne Ibarra and one by Laura Diamondstone. They each are covers for a proposed pilot program for Promotores de Salud. And I think Roseanne Ibarra's cover letter in particular absolutely nails this type of program. It's very common in Latin America. And in essence, people are recruited from the community, and then they are trained, in effect, to be community health workers. And there's no question of there being a barrier or inaccessibility or lack of trust or rapport because they are recruited from the communities that they then work in. So it's a very promising model. And given that our experience in those for whom the ethnicity is known, 75%, 3 times the population. Obviously, we have a huge problem here, and the proposal to have Promotores de Salud is, to me, entirely appropriate and the type of game changer then that we need. Rather than have people go around and hang door hangers on apartment doors, we could have people embedded in the community, directly contacting people, speaking to them in their language. And this also, it would be COVID related initially, but looking for the long term, this actually would be a huge step forward in addressing health equity in our community. So I think we should take a serious look at that. I believe during the fiscal report, and I had asked previously, of the $750,000 that we had approved for Mask Up Mendo and for outreach, less than $250,000 had been encumbered. This proposed pilot program would be $85,000. It's for a 6-month term. It is forecast to be in the Anderson Valley. I did speak with the director of the Anderson Valley Health Clinic. They are ramping up their outreach to the Latino community. They see this as complementary, so they don't see it as, they're stepping into our turf. We know there's a crying need for this type of program in the Ukiah Valley, but I would like to see the board have some discussion and possibly give direction. Do we want to have our staff pursue the Promotores de Salud model to better outreach to the Hispanic Latino community? Thank you.
Yeah, thank you for those comments, Supervisor McCowan. I've been meeting with Roseanne Ibarra and Tammy Moss Chandler and Director of the Health and Human Services and CEO Angelo. And I do believe that there is an intent to pursue this model of Promotores de Salud, and it's very hopeful. And I don't know if CEO Angelo has anything to add to that.
Chair Haschak, thank you very much. Yes, I wanted to add the Promotora model has been around for decades. It's an excellent model. And we are all very appreciative of Roseanne Ibarra bringing this forward. This is already being worked on, as you know, Chair Haschak, with yourself, with our new health officer, Dr. Corin, and Tammy Moss Chandler with Roseanne. So we anticipate that this model will be adopted and implemented in our county. I don't think, given all of the items that this board has to deal with during board meeting days, I don't think we need any further discussion. It's already in the works. And with the next COVID update, there could be an update on the Promotora model. Thank you.
Okay, thank you. And that's very helpful. So with that, if there's no further questions, we'll try to come back to Supervisor McCowan's letter later in the day. And because it would be good to be able to talk to the public health officer at length. You know, I don't like to make these kind of decisions at the last minute, but let's put that off. We'll table it till later in the day because we have a lot of work to do. So,
Chair Haschak, I support you on that. As long as we come back to it, we can't run out of time because our next meeting is the 22nd. It's three weeks out. And so I think before we end our session today, either we need to approve the letter subject to changes, or we need to ask two supervisors to work on it and send it prior to our next meeting. I would be content if either one of those happens, but I don't want to run out of time and then return to it 3 weeks from now.
Okay, so we'll get back to it. All right.
And one more thing also, Mr. Chair, I appreciate your very positive comments as well as CEO Angelo's to the Promotora's model. And, you know, I'm not advocating specifically for the pilot program that is proposed for Anderson Valley, but unless there's any objection from the board, I would hope based on the comments here that it can be taken that the board is giving direction for the executive office to move in the direction of instituting the Promotora's model. So it won't be a surprise if we're told we've contracted with someone or we've done an RFP or whatever is deemed appropriate to get the ball rolling.
Yeah, I think you heard that from the CEO that we have a team working on that, Supervisor McCowan. So thank you for your support. All right.
Thank you.
Very good. Okay, moving on to item 6A, discussion and possible action, including direction to County Council to draft necessary framework to establish a public safety advisory board consistent with appropriate legal and labor requirements. Okay, the sponsors are the supervisors Haschak and Jurdy, which is the ad hoc committee, and Sheriff Kendall. So I'd just like to say I appreciate the collaboration we've had on this from a wide variety of people. And I'm going to, since I'm a co-sponsor, I'm going to pass the gavel to Supervisor Brown. If you can do that by not seeing people. Is that possible, Supervisor Brown?
Yes, sir.
Okay. Thank you very much. So let's see. Supervisor Jurdy, would you like to start this off?
Just very briefly, we've had a number of very interesting conversations. Supervisor Haschak, Sheriff Kendall, and with a number of community members, including a retired judge and county council, and we think we have a proposal here that will help to address a number of issues that will hopefully lead to just better public safety in Mendocino County. It's a common goal that everyone shares. And I think we have a number of different strategies to get there. And I'll just turn it back over to Sheriff Kendall and Supervisor Haschak.
Okay, Supervisor Haschak?
Yes, I'd just like to say, you know, there are many residents of our beautiful county who are concerned with public safety. And we have people concerned about safety, our environment, our communities. How are we going to make positive changes that enhance our communities? And so I think that this has been a perfect example. It came from citizens, and in a time where we don't have a crisis at hand, as far as, George Floyd situation or anything, but we were able to take this and be proactive and work in collaboration with Sheriff Kendall to create this proposal, this Public Safety Advisory Board, which would create greater transparency, which would have citizen involvement, which could be a conduit for communication between law enforcement and the community, and also try to break down some of those barriers that we have between different agencies, such as law enforcement, mental health, substance abuse, disorder treatments. And so I think this, also, we have this opportunity to work collaboratively together. And I really appreciate Sheriff Kendall and the team that we had together. We met every week, like Supervisor Journey said, for the last 2 months. And I think we've come up with a good product.
Thank you, Supervisor. Sheriff Kendall?
Thank you, Supervisor Brown. So Supervisors Hashtag and Journey mentioned, we've had several meetings with community members. It's very clear, though, and I do need to voice this, that this is something that is pointed at law enforcement and mostly is, I think that it needs to be a discussion that is deeper and moves into all persons who serve the public. Eventually, I think we're going to get there. Thank you.
Thank you, Sheriff. Board members, comment, and then we'll go to the public. Hearing no comment from the supervisors, we'll go to public comment. Clerk, do we have anyone waiting in the waiting room to speak?
Yes, Supervisor Brown, we have Jan McGordy on the line.
All right, Ms. McGordy?
Hello?
We hear you. Thank you.
Yes, it's the unmute thing. So I would just like to support this whole idea and encourage the Board of Supervisors to endorse this and create this really important board. It's been helpful in many communities. I mean, good for Mendocino County. We're not in crisis. We haven't had a recent shooting by law enforcement that creates these things usually, although in the past there have been more than one mentally ill people that have been killed by law enforcement. So I would just encourage this to be as inclusive as possible and to look at other communities for models on how it should be arranged. For example, in LA County, the sheriff has a specific way that it's organized. But anyway, thank you so much, and thank you for considering this, and good luck.
Thank you. Is there anyone else?
We had one other person sign up, but they have not yet called in, so no.
Okay. And all correspondence has been attached to our agenda that's been received to date, correct?
Yes, Supervisor Brown, this is Deputy Clerk Lindsay Dunham, and all correspondence received has been attached to the item and made public.
Thank you very much. Okay, it's back to the board. Any comments?
Madam Chair Pro Tem, if that's your title.
Supervisor McCowan.
Thank you. So the proposal refers at one point, this is in 3A, ensure that complaints are appropriately dealt with for county employees. And I heard Sheriff Kendall say that he thought this should apply to all county employees. So could I get some clarification on the limits of this committee? Will they be looking at racial discrimination that may occur outside of the sheriff's office?
If I could answer that.
Yes, Supervisor Haschak.
Yes, thank you, Madam Chair. Pro Tem. That at the moment we're looking at law enforcement, whether it be a deputy sheriff or special investigation unit chief probation office or the probation officers or the investigators. You know, those parts of law enforcement. We also have the task force that's being formed, and that task force would be looking at, you know, racial or whatever kind of issues that might be involved in other parts of the county. So I think that, you know, we're ready to work on it, and I appreciate Sheriff Kendall's comments.
Thank you. And were probation or special investigations unit involved in the meetings at all? Since they apparently, it's intended they would be subject to it?
Yeah, yes, Madam Chair.
Absolutely. Go forward.
Yes, they've all been contacted. We heard back from the Chief Probation Officer. We've heard back from John Martyr, head of the Special Investigations Unit, and basically positive comments about it. Some questions, certainly, but positive.
Thank you. And of course, we're very concerned about the budget year that we're going to be going into. This will be something that I won't be having to deal with in the future, but there's no budget information on this. It says not applicable, and yet have we looked at what similar programs cost in other areas? This is going to be meeting weekly. There would need to be some staff. And in fact, what would the staffing be for this committee? I might have missed that if it was included in the proposal.
So if I could, Chair Brown.
Supervisor Jurdy, please go forward.
Yeah, so to clarify, it's envisioned that this Public Safety Advisory Board would meet once a month. And we are not envisioning staff dedicated for this. Certainly I'm not. We're looking at this as a citizens advisory board with, public meeting notices and minutes, but that's the limit. We do believe that county staff from various aspects of county government that are involved in public safety will be participating in those meetings. So that would be indirect staff time. But I believe the public safety employees would probably actually appreciate the ability to maybe better coordinate public safety response to issues that members of the public perceive in Mendocino County.
Thank you, Supervisor. Supervisor Williams?
I support it. One of the goals that's not articulated here is, of course, reducing settlements that involve public money. But I think it's a fair proposal.
Thank you. And I would like to comment on Supervisor McCowan, some of his statements about the entire organization. I do believe that harassment training that every county employee receives does address discrimination in the workplace and gives employees the right to go to their supervisor in their department and address the issues if there are any. So I do feel we have something in place, and I think human resources may step in as well. Just not sure exactly how that system works, but I do know we all receive the training. I believe it's required every 2 years. So I think that that's taken care of. Anyone else comment?
Madam
Hearing
Chair.
none.
Madam Chair,
I
would
would
it be
like to
all right if I
entertain a motion.
Yes, Madam Chair.
Yes, sir.
I'd like to move this item.
So that would be the recommended motion?
Right, as proposed.
Okay, and that would be to direct county council to draft necessary framework to establish a public safety advisory board consistent with appropriate legal and labor requirements. Is there a second?
I'll second the motion.
Okay, we have a motion by Supervisor Haschak, a second by Supervisor Jurdy. Clerk, please conduct the roll call.
Yes. Supervisor Williams?
Yes.
Supervisor Jurdy?
Yes.
Supervisor McCowan?
Yes.
Chair Haschak?
Yes.
And Supervisor Brown?
Yes.
Thank you. The motion carries unanimously.
Thank you. And I turn the gavel back over to Chair Haschak.
Well, thank you, Supervisor Brown. And before we leave this topic, I'd like to thank the diverse, passionate, thoughtful group that persisted to get this done. I want to thank Supervisor Williams for co-sponsoring the original item. And I want, on behalf of Supervisor Jurdy and Sheriff Kendall, I'd like to really express our appreciation for the work done by Troy Tognoli, Roseanne Ibarra, Mary Norris, Kat Willits, David Nelson, Juan Orozco, Jack Crispin Kane, Miranda Ramos. We appreciate your love for our county and our communities. So thank you very much, and hopefully you'll make for a better county for everyone. So, Sheriff Kendall, did you have anything to add to that?
No, I think it's been a good experience working with people to move towards this. We'll see where we can get this year. I will stand firm that this is something that needs to occur across the boards. And I know right now it's focused on law enforcement because that does meet the national narrative. But the fact of the matter is it needs to be for all county departments. We cannot include one and disinclude another because that's one of the things we're fighting against. Thank you.
Okay, thank you. And Supervisor Jurdy?
I don't have anything else to add, but I thought I heard County Council trying to speak up a little bit earlier. Does he have something else to add?
Thank you, Mr. Chair. I was just going to add, for the benefit of anyone in the county organization who may be watching, the harassment and discrimination policy does allow employees not only to go to their own managers and supervisors, but to any manager or supervisor within the county system or directly to HR if they have any complaints. I just want everyone to be aware that there is no restriction on where they're able to go, and that the policy does authorize the HR director to address and respond to those issues. Thank you.
Okay, thank you. I'm going to move on to item 5C, which is discussion and possible action, including approval of the Board of Supervisors' response to the 2019-20 grand jury report, the emergency communication system in Mendocino County, and disbanding of the grand jury ad hoc committee. Sponsors is County Council and the Grand Jury Ad Hoc Committee of Supervisors Williams and Jurdy. Okay. Supervisor Williams or Jurdy? Would you like to
Well, I think the response speaks for itself. I assume we've all had a chance to review it. Are there any questions?
Mr. Chair?
Yes, Supervisor Brown.
I have none, and I thank the ad hoc for their work on this.
Yes, I would say the same. Thank you. Okay, any further comments?
I'd just like to add, I'd like to thank our county staff, the Information Services Department and CO's office and Sheriff's Communications Office for doing everything they are to develop a strategic plan for our communication system and hopefully, funding stream to maintain it in perpetuity.
And last, the grand jury for choosing this and providing recommendations that are common sense and steer us in a direction of better public safety. Good work.
Mr. Chair.
Yes, Supervisor McCowan.
Well, I do believe that the grand jury became alert to this issue because it's been before the board a number of times. And I do believe we've adopted an IT master plan, which did include key references to the ECS system. So, I also believe we have already allocated significant funding towards implementing the plan and addressing some of the more critical issues. One question I had on finding one, it says that IS, in collaboration with the Executive Office and the board's Information Technology Ad Hoc Committee, has authored a master plan. Is that a different master plan from the IT master plan?
I believe we're referring to the IT master plan, but it goes on to talk about the need for ongoing maintenance and funding, which is still in the works.
Correct, and I think we've detailed the ad hoc to come back with recommendations on that, but it doesn't seem factually accurate that the ad hoc has authored the IT master plan, or did you? Maybe you did.
Maybe collaboration on authorship would be more appropriate language. But
well, I thought we had a master plan, we adopted it, and then, or maybe we did appoint the ad hoc prior to adoption. So I'll leave that one alone. I would like to maybe agree a little bit more with the grand jury on F7. I think that we could delete the single word partially agrees and simply say the Board of Supervisors agrees with this finding, and then the rest of the statement does qualify that it's more than simply tracking maintenance and thinking you can project what you're going to need in 15 years based on that. But I don't think we have any fundamental disagreement with their statement. So that'd be my only suggestion, would be potentially strike the word partially from the response to F7 and then change the reporting to say that we agree with F7.
Mr. Chair, Janelle Rao, Deputy CEO, if I might just chime in a bit.
Go ahead, please.
And I do want to extend my appreciation for the IT ad hoc for their work with this, which was in collaboration with the Information Services Division and our communications team. While I understand and appreciate Supervisor McCowan's comments, fully agreeing with the grand jury wouldn't necessarily be appropriate, given that much of the work that was contained in that grand jury report had already been underway and implemented via the IT master plan. I do concur that perhaps some clarification, as Supervisor Williams suggested, in the authoring, so to speak, of the IT master plan, which was done via a competitive process and in consultation with our IT master plan consultants, Client First. The rollout and implementation of the IT master plan in its total, which included the microwave system and public safety communications, and the IT master plan, or the IT ad hoc committee, has been working collaboratively with information services on that rollout. So I'm not certain if there's any information. I don't have any direct opposition to changing anything in the response, and I would defer to the IT ad hoc.
Chair Haschak.
Yes, Supervisor.
Yeah, so
Wood.
in F7, I think the reason we have partially agreed is because the clause, there is no supporting documentation for accurate forecasting. It's not accurate that there is no supporting documentation. I think it's accurate that the documentation is not sufficient and it's a work in progress. But it just wouldn't be accurate to claim that there isn't any. And it may be that, I don't know if the grand jury requested it. I'm not sure what they reviewed. And it may be that it was not available and this was their determination based on the facts presented. But from the facts we have, clearly there is some documentation. So I would urge us to leave partially in place.
Mr. Chair, I'll defer to the ad hoc.
All right. Okay, seeing no public comments, we'll go back to the board. Okay.
I move the recommended action.
I'll second.
Okay, very good. Any further comment? Okay, Deputy Clerk of the Board, could you conduct the roll call vote?
Yes. Supervisor McCowan?
Yes.
Supervisor Dirty?
Yes.
Supervisor Brown?
Yes.
Supervisor Williams?
Yes.
Chair Haschak?
Yes.
Thank you. The motion carries unanimously.
Okay, very good. We're going a little bit out of order. We need to finish by about 11:40 so we can go to a closed session. So let's see. We're going to go to supervisor reports right now. So is there anyone who'd like to start it off? Okay, Supervisor Brown.
Thank you. You took me by surprise. I want to mention, first of all, the fact that I did receive a thank you letter along with signatures from a neighborhood, and that is Vichy Hills Drive. And I was thanking me, but I need to thank Department of Transportation. They had a really horrible pothole situation, and our road crew, Ukiah Yard road crew, have been up there working, and so they wanted to make sure that the department was recognized along with our county employees. So, moving on, since the last meeting, attended via Zoom, Behavioral Health Advisory Board meeting. I have been working on the hazardous vegetation abatement ordinance with representatives from the Fire Safe Councils countywide. We will be having something coming back, but it'll probably be a month or so, maybe a little bit more. Before it can come back. I was on Zoom for a meeting, Redwood Valley County Water District, to receive updates about their infrastructure and all that's going on, especially during this drought. And attended an area agency on aging board meeting, as well as sat on a committee to go over some proposals that were submitted for funding that the AAA had. Also, I've been on all the Cal OES calls, and they've been both on wildfire and COVID that have occurred. They are now with the wildfires. They're occurring 3-4 times a week, and sometimes you just have to keep watching because they have a last minute call that needs to be made. And update county supervisors, city council people, as well as the legislature and their representatives. So I do appreciate being on those calls and all the information I learned. Thank you.
Right, Supervisor McCowan.
Thank you, Mr. Chair. I believe we all got a memo from the Mendocino County Employees Retirement Association, and they note that 2 of the seats that we appoint expired November 30th, 2019. They have been noticed. I think we have probably 2 people in those seats willing to continue. Not sure if anyone else has applied. They also note that our other 2 appointees, including Supervisor Jurdy, that their terms will expire November 30th, 2020. So it's a little premature to be thinking about them, but ideally staff is moving forward with the 4th seat and the 6th seat. The only other thing I'm going to mention today is the Mendocino Fire Safe Council has funding to assist low-income seniors and disabled with creating defensible space around their dwellings. And I think the qualifiers are about $34,000 annually for a 1-person household, $38,950 annually for a 2-person household. So any individuals who are senior or disabled and income qualify, you can get assistance in creating defensible space around your dwelling. Please contact the Fire Safe Council for more details. Thank you.
All right, Supervisor Jurdy.
Just a couple things. The Library Advisory Board's ad hoc committee, which is meeting with Supervisor McCowan and myself, had a recent meeting. The Friends of the Libraries have had meetings on the same topic, which is the renewal they'd like to go to the voters in 2022 for a renewal of the sales tax to support the county libraries. They're working on the project. We're helping them as we can, and just want to make sure people knew that that's still in the works in spite of COVID. And let's see what else. There's been a number of meetings with county staff and West Company, Supervisor Williams and myself, about the $350,000 of CARES Act funding that the county has dedicated for small business, micro business grants, and that will be rolling out hopefully in the month of September, and we hope to use these funds to help out a significant number of very small businesses. Micro businesses are defined as 5 or fewer employees.
Okay, and Supervisor Williams.
There are 2 broadband bills that are pending at the state legislature. AB 570, in my words, would keep what we have today in place with use of the California Advanced Services Fund. What we have in place today I don't think is connected to any houses in Mendocino County, and I think it'll be a surprise if we ever see that come through. A competing bill, SB 1130, would not give AT&T the first right of refusal, would require 25 megabits instead of 3. On its face, looks like it's the next generation broadband deployment model. Unfortunately, we would probably not see any of it because areas with higher density would be competing for those funds. It leaves us in a position where we're just not seeing the state funding for rural deployment of broadband. The grant that has been worked on for the eastern part of the county had to be scaled back. There simply wasn't enough money in the pot. We were asking for more just for our project than the entire available funds for the whole region or state. I think we should probably provide a letter, and I think our legislative platform adequately covers it. If the board is all right, I'd like to work with staff on providing a letter of support for the concept, but requesting that we see a projection of how either of these bills will positively impact broadband deployment in our county. And I think that may shed some light on if the answer is probably it won't, well, then we can start talking about changes to ensure equal distribution of services. And then on broadband, but a slightly different thread, I've been having discussions with SpaceX. They have a Starlink service that is being rolled out. It's in beta now, and they say that they can deploy in Mendocino County today. They need an NDA signed. It's currently sitting with County Council. The difference between this and legacy satellite services is the latency. The speed of light, essentially the signal traveling up to the satellite back down, that distance 4 times, about 80,000 miles, that has made legacy satellite unusable for a lot of high-speed broadband applications. Starlink is only about 340 miles, and so it provides service that's comparable to, say, Comcast cable, but can be available anywhere in Mendocino, no longer distance dependent. And they have a beta program that's in process. And there's some, it's possible for the county to get in on that. I think we should try to utilize it for some key locations, say Covelo, the library, schools that are outside of broadband coverage that are facing more hurdles trying to do distance education. There's an opportunity in front of us to make use of available broadband, and the price is in parity with cable and DSL services that already exist. Chair Haschak, would you like me to give an update on the cannabis ad hoc?
Yeah, please go ahead.
The cannabis ad hoc has been meeting regularly several times per week with state agencies and with staff, with MCA, the trade association, and with a handful of cannabis cultivators. And I think we're feeling that the state is not providing hurdles. The state agencies are working with us, and I think we can get through the process. We all have some hesitation about whether this program will work for all applicants. I think staff sees that many applicants may ultimately be denied. Some of those applicants should be denied. Their projects don't conform to the current ordinance and do have significant environmental impacts. But a whole lot of them are pre-existing and do conform and likely will not get through the process, raises concern. The board has directed the ad hoc to not work on a use permit or a new model, but continue ensuring that we follow through on the current ordinance. And so we're taking that seriously. That's the only direction this ad hoc is headed at present. But one of the primary concerns is available staff. And it seems that there are 272 current permits. All of those will need staff time to complete the CEQA checklist, the project description, work with the state agencies to get the applicants to the stage of annual permits. So you have 272, say, just hypothetically say those take 14 hours apiece. You're talking about 3,808 hours. And then we have 882 that are not yet at the county license stage. Some of these applicants have not heard back from the county in 3 years. So what is the current state? Well, we don't know. It may be that the county asked for additional paperwork. It may be that the applicant emailed that to an ag employee directly who's no longer with us. Could be that ITIS could pull it out of an email box, but trying to match up email addresses with pending applicants, it's a mess. It's foreseen that it may take 5 hours per file just to make sense of the current state. So you have 882 that are in this situation. So let's put in 5 hours each, just doing a little bit of back of the napkin math here. And then those 882 will also require the CEQA checklist, let's say 14 hours again. So now we're up to 20,566 hours. And if we figure that 40-hour weeks, and maybe that staff is 75% efficient because internal staff meetings, trainings, context switching, you're talking about 385 human weeks. that's a problem. We only have until January 1st, 2022 to get all of the applicants to state annual licenses, or their legal cultivation will end. I think what's in jeopardy here is an industry that's worth maybe more than $500 million per year and about $5 million of revenue to the county. And what we're seeing is we don't have a staffing plan. No matter what findings from our pilot program, we see that we need far more time than current staff has available. I'm worried that even if we were to start hiring today, we couldn't find enough qualified and competent planners to get the work done in time. So the ad hoc will be bringing back some recommendations, but I think we wanted to share the earliest possible time. We have a serious problem with staffing. If we find that we want to continue with the current ordinance, we don't have a planning staff that can support the needs. We may have to outsource it. Chair Haschak.
Yeah, I agree with what you said, that we'll have to come up with a recommendation for how we're going to get staff either internally or externally to be able to process people, because we have a commitment to people to help them with this, the process. We're creating the pathway right now. I feel like we've created a pathway with CDFA, and we've also have a pathway with CDFW with the pilot program that just got approved. So those are looking like, we have a way of getting people to their annual license if they qualify. We just need to do our part with the CEQA checklist and the sign off. So
when we talk about needing additional resources, we don't know exactly how much time. That's why we're doing this pilot program. Based on the numbers I've seen so far, the projections, if we wanted to process all of the current files within 6 months, I could see needing 16 additional planners. And if I don't know if Brent Schultz is on the call, if he wants to disagree, now would be a good time to do it. Or if he thinks it's more than 16, less than 16, speak up. But just from the numbers I've seen, I think we need to hire 16 planners essentially tomorrow. And if we don't think that's possible, we need to start putting an RFP together and outsourcing this work. And that outsourcing will be difficult because most of the records are not in digital form. We can't have a contractor access the existing records short of sending the files over. Cannabis files are inherently intertwined with other permits. The cannabis applicant has well permit, probably some building permits, hoop house permits, all sorts. I don't know that we want to collect all that paper and send it to a contractor. We also, because of COVID, can't be putting more people in the existing space because of the distancing requirement. And so I don't mean to be pessimistic here, but we have a real problem on our hands. We have a timeline that we can't possibly meet with the resources we have at our disposal.
All right. Well, thank you for that report. Supervisor Williams is certainly in detail about the problems we're facing with the cannabis program right now. But hopefully at the next meeting, we'll come back with a plan that we'd hope that the board will support. Okay, is that it?
Yes, thank you.
Okay, so Supervisor Williams talked about the cannabis ad hoc. We've been meeting a lot with all sorts of different groups and staff. I've been meeting with the Equity, Diversity, and Inclusion Task Force, and we're trying to come up with a model for that task force and how it will function. I had a First Five meeting, a Workforce Alliance of the North Bay. A meeting that we had that I appreciate Sheriff Kendall being in on and CEO Angelo was with Senator McGuire and people from the State Office of Emergency Services and U.S. Cellular concerning the situation in Covelo and other outlying areas of our county. But the cell service where even 911 service wasn't available. And so we've had 2 meetings so far. We're supposed to have another meeting this week. And I certainly appreciate Senator McGuire's interest in this and his pushing on behalf of our county. And I'm sure Sheriff Kendall and CEO Angelo would say the same thing about what Senator McGuire has been doing to help us try to resolve this situation that seems like it's gotten dramatically worse in the last couple of years up there. So, and when you have emergencies such as fires, arsons, murder, and all those things happening, and you don't have 911 service, that's not right. And so hopefully we can get that taken care of quickly in the short term and figure out a long-term solution to it. We had the ad hoc committee for the law enforcement issue advisory board. So we did our work. Thank you for the support on that. And I'd like to disband that ad hoc if the board so chooses. Our work is done. So, and then yesterday I made several calls to Senator McGuire and to Assemblymember Wood about AB 6, which had to do with the opioid settlement and the Attorney General trying to take it out of the county's hands. And so fortunately at the last minute that was not approved by the state legislature in their meeting that went on till 1:30 last night, but it was very close because it was one of those things at the last minute. You never know which way things might go. But fortunately it got shot down. So, and then with Supervisor Williams' comments about the broadband, I'd certainly co-author a letter with you since we're both on the broadband committee. And yeah, I think that the state needs to be accountable for what kind of service we're going to have into the future and come up with their plan, or at least explain it to everyone. With that,
Mr. Chair?
Yeah, Supervisor Brown.
Thank you. Supervisor McCowan brought up the letter from, I actually had it in my stack to comment on. So I thank him. Just didn't pull it out in time. But Mendocino County Employers Retirement Association and the reappointments, will you take responsibility to see that that comes through?
Yes, that's directed at me, right?
Correct.
Yes.
Okay, thank you.
All right, and with that, we'll go to closed session, and we will start at 11:50, okay? Or let's say 11:55. Okay, so with that, we'll adjourn until 1:30. Oh, and in closed session, we are going to deal with items 9A, 9B, 9C, 9D, and 9E. Okay, so meeting adjourned. We're going to closed session. We'll come back at 1:30. Reporting out from our closed session, we had items 9A, B, C, D, and E, and direction was given to staff in all cases. So thank you. And moving on to item 5B, discussion and possible action, including approval of amendment to PA Agreement 20-81 with Liebert Cassidy Whitmore, LCW, effective September 1st, 2020, increasing the total compensation by $125,000 from $75,000 for a new agreement total of $200,000 for litigation services for Grual versus the County of Mendocino. Sponsor was Risk Management. So I'll turn it over to CEO Angelo. Or
thank you. Thank you, Chair Haschak. Yes, it'll go to Ms. Carell.
Okay.
Hi, Heather Carell Rose, Senior Risk Analyst with your Executive Office. This item is a continuation from the last board meetings item where you approved a $25,000 increase to the contract. Now we're asking for further compensation for the contract up to $200,000. This is in anticipation to budget for the life of the claim as opposed to any particular litigation milestone. So I present this contract to you and ask if the board has any questions.
Okay, are there any questions from the board at this point? Okay, hearing none. I don't believe we have any speakers. Public comments on this. So we'll go back to the board.
Mr. Chair?
Yes, Supervisor Brown.
I'd like to move the recommended action.
Second.
Okay, it's been moved and seconded. Any further discussion? All right, Deputy Clerk, could you conduct a roll call vote?
Absolutely. Supervisor Williams?
Yes.
Supervisor Jurdy?
Yes.
Chair Haschak?
Yes.
Supervisor Brown?
Yes.
And Supervisor McCowan? Supervisor McCowan? You're muted, Supervisor McCowan.
Yes.
Thank you. The motion carries unanimously.
Okay, thank you.
Thank you.
Mr. Chair?
Yes, Supervisor Brown.
Thank you, sir. And maybe I just didn't hear it, but did you report out a closed session?
Yes.
Okay, thank you.
Okay, agenda item 5D, notice public hearing. Discussion and possible action including 1, adoption of resolution adopting a negative declaration for a general plan amendment, rezoning, and use permit. 2, adoption of a resolution approving general plan amendment, GP 2019-0005, Gold West Land Company LLC. 3, adoption of an ordinance rezoning R 2019-0006, a portion of one legal parcel located at 43045 Highway 101, Laytonville, APN 035-150-25, totaling 1 plus or minus acres, currently designated remote residential and zoned upland residential to rural community. And 4, adoption of a resolution approving a minor use permit U 2019-0009 to allow for cannabis retail, manufacturing, volatile and non-volatile, and distribution. Okay, Planning and Building Services is a sponsor. Okay, Deputy Clerk, has notice been established?
Yes, proper notice has been established.
Okay, I'll open the public hearing. And Clerk, has there been correspondence and telephone calls received?
No telephone calls received, and any correspondence received has been uploaded to the item.
Okay, thank you. Okay, staff presentation.
Thank you very much, Chair Hashak. Julia Acker-Krog, Chief Planner. I'm going to go ahead and turn this over to Vandy Vandewater, who is on the line here, and he'll go through the presentation. And afterwards, of course, we are available for questions.
Good afternoon, Chair Haschek and supervisors. Sam Vandy Vandewater with Planning and Building. So as you read through the item title, this is multiple pieces of one project. So there is a general plan amendment, and this would be changing the general plan designation from remote residential to rural community. There would also be a rezone from upland residential to rural community, as well as a use permit that would allow for the retail, distribution, and both non-volatile and volatile manufacturing of cannabis products. This is located about 1.5 miles south of the Laytonville downtown area on the east side of Highway 101. The general plan amendment rezone and use permit would only be affecting a 1 acre portion of a larger, roughly 80-acre parcel. The project had been referred out to a number of agencies, and there were no significant comments received by anyone of concern. And the project was found consistent with both the zoning code and the general plan. Prior to the Planning Commission, there was a contract established for the rezone. However, during the Planning Commission hearing, the contract was removed, and so the rezone would allow for all allowed uses within the rural community zoning district. And other than that, an initial study was prepared for the project, and it was found to be in accordance with CEQA. And the Planning Commission, by resolution, recommends that the Board of Supervisors adopt the negative declaration and grant the general plan amendment, rezone, and use permit for the 1 acre portion of the subject parcel. Thank you.
All right, thank you. So there haven't been any public comments about this?
There, Vandy Vandewater, Planning and Building, there was one comment email received by CAL FIRE, but their comment was a very general comment just stating if this parcel is in timberland that they need a timber removal permit, but this parcel is not in timberland zoning, so the comment really doesn't apply.
Okay. All right. So are there no other public comments about this? Any questions from the board or comments?
I do have a question, Mr. Chair.
Yes, Supervisor Brown.
I'm very interested in hearing from you as a District 3 supervisor and your opinion.
Yes. Okay, thank you. Yeah, I have contacted the MAC, the Laytonville area MAC, for their comments. I guess they received the notice in 2019. They really didn't have any comments. And then when I talked to the chair, he was all right with it. And so, and when I checked with Planning and Building, they said they hadn't received any comments from the MAC. So I appreciate that outreach. I guess without any comments from the neighbors and the Planning Commission's recommendation, I'm in favor of this.
Thank you for giving your opinion. It's important for the district supervisor, I think, to do so. And without further ado, I move the recommended action.
Well, I need to close the public hearing. So
that's right. Thank you.
Okay. Any further questions from the supervisors?
I'll second.
Any closing remarks by the staff?
Not at this time.
Okay, thank you. So I'm going to close the public hearing. Okay, we'll take it back to the board. Supervisor Brown, now's an appropriate time.
Yes, I move the recommended action.
Okay.
Second.
Okay, seconded by Supervisor McCowan. All right. Deputy Clerk, could you conduct a roll call vote?
I certainly can. Supervisor Brown?
Yes.
Supervisor McCowan?
Yes.
Chair Haschak?
Yes.
Supervisor Jurdy?
Yes.
And Supervisor Williams? The motion carries unanimously.
Thank you, Chair and Supervisors.
Okay, thank you, Vandy, for your work on this. And the rest of your team at Planning and Building. Okay, agenda item 5E. Notice public hearing, discussion and possible action, including rescission and simultaneous re-entry of Williamson Act contracts for the lands of Rawa Vineyards LLC and Anderson Vineyards Inc., located at 4741 Highway 128 in Philo. Okay, APN numbers 026-295-10 and -37 and 026-330-06-44 or 026-394-14. Okay, Planning and Building is a sponsor. Okay, so the clerk, has proper notice been established?
Yes, proper notice has been established.
Okay, I'm going to open the public hearing. Okay, so Deputy Clerk, has there been any correspondence or telephone calls received?
No telephone calls received and any correspondence received has been attached to the item.
All right, I'm going to turn it over to Planning and Building to introduce the item.
Good afternoon, Russ Ford, planning staff. So just a quick background. This project is the result of a boundary line adjustment between Anderson Vineyards and Rawa Vineyards. When Rawa acquired the property last year, they determined that there was a very slight discrepancy between the deeded property line and the existing fence line. They choose to execute a boundary line adjustment just to make that minor shift. One of the conditions of the boundary line adjustment was that they apply for this rescind and reenter, just because they are two separate contracts, two separate owners. So we wanted to keep those ag preserve contracts in line with the legal boundaries. So this was heard by the PC back on July 16th. They recommended approval and staff recommends approval of the project.
Okay, thank you. Now, are there any public comments? Deputy Clerk?
There are none.
All right. Okay, so any questions, statements, comments from the board? Hearing none. Okay, staff, do you have any final comments?
We have no additional comments. Thank you.
Okay, I'm going to close the public hearing. The matter is back before the board.
Move the recommended action.
Second.
Okay, it's been moved and seconded. Are there any other comments from the board?
Mr. Chair?
Yes, Supervisor.
I appreciate the fact this is before us today and keeping all our Williamson Act contracts, properly and legally in order. So I appreciate having this item on the agenda. So thank you, staff.
Okay, very good. Deputy Clerk, could you do a roll call vote?
Yes. Supervisor Jurdy?
Yes.
Supervisor McCowan?
Yes.
Supervisor Brown?
Yes.
Supervisor Williams?
Yes.
And Chair Haschak?
Yes.
The motion carries unanimously.
Okay, very good. Thank you. Agenda item number 5F, notice public hearing, discussion and possible action, including adoption of resolution approving agricultural preserve number A219-0002, authorizing the addition of APN 133-020-09 to the existing agricultural preserve and Williamson Act contract for Lance and Jamie Stornetta in Manchester, APN 133-020-09. Okay, so sponsor is Planning and Building Services. Clerk, has proper notice been established?
Proper notice has been established.
Okay, has there been any correspondence or telephone calls?
There have been no telephone calls and no correspondence received for this particular item.
Okay, staff, would you like to introduce this?
Good afternoon, Russ Ford, planning staff once again. So this is another project that is related to a boundary line adjustment. This has to do with the Windy Hollow Dairy owned by the Stornettas in Manchester. There was an existing 44-acre parcel that was adjacent to the dairy lands. The parcel itself was not under Williamson Act, but it had been used as part of the dairy, and there was a single existing residence on it. So they previously completed a boundary line adjustment to leave just a 5-acre parcel around the residence. The remaining 39 acres was incorporated into the rest of the dairy property. So the purpose of this application is just to extend the existing Williamson Act contract and Ag Preserve over to that 39 acres to officially incorporate it into the rest of the Windy Hollow Farm production. And this project was reviewed by the Planning Commission back in October of last year and recommended approval, and staff recommends approval.
Okay, thank you. Is there any public input? I don't see any. Deputy Clerk, do you have any public input?
There is no request for public comment on this particular item, Chair Haschak.
Okay. Are there any questions or comments from the board?
Mr. Chair?
Yes.
Thank you. And it is Supervisor Brown. I've known the Stornetta family most of my life. I've certainly known Lance Stornetta all his life. And I greatly support what they're doing. They're the last dairy that we have. Holstein milk cows here in Mendocino County, and I fully support this.
Okay, thank you. Any further comment from the board? Okay, hearing none. Staff, do you have any final comments?
No, we do not. Thank you.
Thank you.
Okay, I'm going to go back to the board.
Move the recommended action.
I'm going to close the public hearing. Now,
Move the recommended action.
okay, thank you. Is there a second? Supervisor Brown, second. Okay. Any further comments? Okay, Deputy Clerk, could you conduct a roll call vote?
Yes. Supervisor McCowan?
Yes.
Supervisor Brown?
Yes.
Supervisor Jurdy?
Yes.
Supervisor Williams?
Yes.
And Chair Haschak?
Yes.
Thank you. The motion carries unanimously.
All right. Thank you. And as I said earlier, item 5G has been pulled by the department to work on it further and bring it back at a later date. Okay. All right. Item 5H. Notice public hearing, discussion and possible action, including adoption of a resolution approving general plan amendment GP 2019-0004 for the 2019-2027 housing element and addendum to the 2009 general plan environmental impact report related thereto. So the sponsor is Planning and Building Services. Clerk, has public notice been established?
Yes, Chair Haschak, proper notice has been established.
Okay, and let's see. We're going to go to the public hearing. Has there been any correspondence or telephone calls?
There were no telephone calls, but there was one piece of written correspondence uploaded to this particular item. It's the last attachment.
Okay, and we all have that?
Yes.
Okay, staff.
If I may, Mr. Chair.
Yes, Supervisor McCowan.
The correspondence that our Deputy Senior Clerk Dunham just referred to is from Sage San Giacomo, Ukiah City Manager. He states that the city just became aware, I think today, or well, recently it says, of this item being on the agenda. And he would appreciate the opportunity for the city to be able to review, offer comments if they believe it's warranted. And I understand also that although this is certainly something we want to get adopted and have it moving forward, it's kind of tied to another item, so it really can't be fully implemented even if we were to vote for it today. So based on that, I would appreciate if you could check with staff and/or county council. Is it advisable to continue with this item today, or is there any great concern if we were to defer action on it? Thank you.
Okay, let's go to planning and building. Maybe they have an answer to that, and then we'll go to county council.
Thank you, Chair Hashak. Julia Acker-Krog, Chief Planner. We would urge the board to keep this item on the agenda today and to discuss it and take possible action on it today. This is primarily due to the fact that there is funding sources that the county is currently, both our community development block grants as well as a LEAP grant, that is dependent upon us having an adopted housing element. So we would urge you today to please keep this item moving forward. I do want to comment that it was posted on the PBS website for 10 calendar days. And, we of course would welcome any further comments from council on this, but we would urge the board to please continue with this item today.
Okay, thank you. County council?
Thank you, Mr. Chair. I don't believe that there are any legal deadlines that would be impacted by continuance, just the practical considerations that planning and building has raised.
Okay, so with that, planning and building, would you like to present this?
Thank you. Yes, Julia Acker-Krog. I'm going to go ahead and turn this over to our senior planner, Jesse Davis. Now, we do have a presentation that has been uploaded with this item. So I just want to confirm with the clerk of the board that we will be sharing our screen from this side in order for that presentation to be viewed by everybody. Is that correct?
This is Deputy Clerk Lindsay Dunham. Yes, Julia, that's fine.
Thank you. Okay, so I'm going to go ahead and share our screen here that has our presentation. So everyone should be able to see our presentation here now, and I will go ahead and turn this over to Jesse Davis.
Good afternoon, Board of Supervisors. Jesse Davis, Senior Planner, County of Mendocino. Today brings us to the hearing before you to update the sixth cycle of our housing element. Before we get started, this is just sort of the outline of the presentation itself. I'd like to give you a brief overview of what the housing element is used for, its sort of regulatory role in our general plan, as well as an overview of the timeline, not the entire timeline, as this is something that was started back in 2018 with the Mendocino Council of Governments when we were assigned our regional housing numbers, but primarily focused on the public outreach phase and the public meetings phase. Talking about the goals, policies, and actions that inform this document, as well as the regional housing needs allocation from the state, which is the primary driver of our response in terms of identifying sites that are capable of meeting those assignments. We'll briefly discuss our site inventory and demonstrate that we have available land to meet the requirements of the state at all income levels, both very low to above moderate. And then ultimately, we'll wrap up with discussing some of our ongoing and related efforts to our housing element itself. The housing element, as you may know, is designed to meet the existing and projected needs of all economic segments of our community. And again, this was a process that was started back in 2018 with the Mendocino Council of Governments when the Department of Finance determined the projected population increase, and through HCD, the Department of Housing and Community Development, assigned Mendocino Council of Governments a regional housing needs allocation. That number was discussed, and then utilizing a past formula, applied the income levels across all jurisdictions, including Mendocino County. This this housing element is part of our general plan. It's one of the numerous elements that speak to facets such as circulation, land use, development, and in this case, housing. The biggest difference between this and past cycles of our housing element is the fact that this cycle is on an 8-year timeline rather than the standard 5. These elongated timelines allow us greater opportunities to implement programs, as well as to respond to kind of the big picture ultimately of how population shifts and grows in California, and more specifically in Mendocino County. And ultimately, it's undertaken in order to ensure compliance with the state laws therein, and particularly those of the Department of Housing and Community Development. Again, I didn't want to discuss the whole timeline. However, in the memo provided with this item, we do discuss detailed dates as well as actions that occurred throughout this process, beginning in May of 2018 and going through the public outreach phase, which was concentrated in 2019. I will note that we had attempted and held 5 public outreach meetings and also tried to do some novel things, such as working with KZYX as well as local media to attempt to disseminate this conversation as broadly as possible. The public hearings were held throughout the county, both in Fort Bragg, Willits, and Ukiah. There was also a meeting in Anderson Valley as well with local stakeholders. As you can see, since receiving direction from the board on December 10th, 2019, we have been working diligently with the Department of Housing and Community Development, going back and forth with their staff to ensure that the document that's before you is in compliance with the state law and their expectations. And I will say that the letter of certification was also uploaded as part of this item, and commend staff for their work on this item. One of our goals moving into this process was to begin to address some of the programmatic items that really move you to identifying and supporting the housing that's identified. So we tried to really look at goals, our policies and actions, and you'll see that part of the biggest change, which was all things considered minimal, was really adding extra details to our policies, to our programs, determining, and that was really the majority of the back and forth with the Department of Housing and Community Development, was providing timelines, timeframes, agencies that were responsible, clarifying the action items to make them more quantifiable ultimately. And I feel like after our discussion with HCD staff that we really do have a more robust programmatic array of sort of action items and goals that we will accede to over these next 8 years to support housing. The biggest aspect of the housing element goal was to demonstrate an available number of sites through our site inventory. And that was the other aspect that we really clarified with HCD, was kind of looking at our rural nature and documenting that we do have land capable of supporting the income levels that the state has identified for us. To give you a kind of high-level overview, and this is something we provided in the previous presentation, as to how the regional needs allocation works. And again, the Department of Finance, in conjunction with the Department of Housing and Community Development, determines what the population increase for any given jurisdiction will be. They then disseminate those numbers to the local council of governance, in our case, Mendocino MCOG. And then those numbers are disseminated across all jurisdictions. Again, we proportionally have used a formula that was utilized in past cycles and was carried forward to ensure consistency. And there was an analysis of who would be more capable of providing some of the low income or above moderate units, and there was some individual trading between the jurisdictions to ensure that we were capable of responding to this number. But this is effectively how those numbers break down across the county. And further details are obviously provided as part of the housing element as well as in the memo. Again, this is actually the specific breakdown for the next 8 years between 2019 and 2027, breaking our numbers across very low, low, moderate, and above moderate. And these income brackets are otherwise designed around area median income, and so are representative of those brackets. I will note, and it's noted here as well, that extremely low income is simply a component of very low as well. So there are a more specific number of extremely low income individuals whose needs we are also trying to meet here through supportive housing and other efforts. One big aspect that I talk about in our memo, and ultimately I think was a disservice to us in terms of reviewing this at the forefront, was really the fact that for the past cycle, the 5th cycle, only an APR, or the annual progress report, was submitted in 2014. We didn't otherwise submit to the state the documents that really gave them the report to show how we were doing. PlaceWorks did undertake one APR as required by state law in 2018, and that was reviewed by you in 2018. But other than that, the 2016, 17, and 19 annual progress reports were not submitted to the state, in part because staff was trying to respond to a number of directives, including wildfire response at that time. So staff took some time, and we went back through each of those years, and we pulled every single building permit, and we analyzed them to determine how much housing we were actually constructing during those time periods. And what we ended up determining was that 2017 was a really great year for us, and ultimately we were able to meet the cycle and the numbers assigned to us by the state for the 5th cycle. And I really wish that this information had been presented earlier, as I feel like it would have changed the tenor of our conversation and ultimately, documented that we are, undergoing construction across this county, whether it's manufactured homes, whether it's multi-unit apartments or supportive housing or single family. We really are constructing new units across the county year after year. This table right here is, demonstrating the number of parcels broken across income groups to determine that we do have sites available, especially to support our lower income population groups in particular. Those are parcels that are otherwise zoned accordingly for multifamily and also have the infrastructure to support them. I should say that above moderate is also a housing type that needs to be addressed. And that was something we heard resoundingly through our times and our public hearings, was that we can't forget about our middle income individuals with regards to their needs in housing. And so providing for those realistic units is also something that we took into consideration, and really something we might be more capable of providing than our incorporated brethren, ultimately, just given our availability of land and the function of size and housing development. So some upcoming and related efforts. The housing element doesn't stop here. As was mentioned by our chief planner, Julia Acker-Krog, the housing element is a regulatory document that's tied to a number of funding opportunities for us, including a LEAP grant, a community development block grant, and also infill infrastructure grants as well that are offered by HCD. Having a compliant housing element is one of the tools that we point to demonstrate to the state that we are progressing in housing and we are compliant with state law. And I think that's a critical facet that shouldn't be overlooked, because this document is what allows us to, stand on a foundation that can provide for more housing, especially as it relates to our very low income population groups. And so one of our goals is to come back to you with a revised inclusionary program. That's something that's still, a board directive that we have not forgotten about, and I think will help to jumpstart housing, with regards to our opportunity to identify more areas. A big tie into this was to finalize the safety element and multi-hazard mitigation plan. As discussed in the memo itself, we actually hoped to tie this housing element to our safety element back in 2018 and 19. Unfortunately, due to a freeze and a federal government shutdown, those funds that were associated with FEMA got tied up, and we had to move forward with the housing element. But that being said, we are knee deep right now in the safety element and our hazard mitigation plan, and we look to ensure that when we talk about safety and hazards, we think about the housing aspect of it as well. So those efforts are ongoing and continuous. We're also going to update our development element to include some additional analysis about communities across Mendocino County. We have a LEAP grant presently before HCD to help update our zoning code and, again, provide more readability and clarity and reduce some of those gray areas that exist in our code to help ensure that when a developer wants to build something, they know the parameters from setbacks to expectations of water connections, septic fields, et cetera. And again, to continue to support residential projects in our pipeline. We're very bullish ultimately on a number of the developments we see, not only along the Brush Street area, particularly Ore Creek, but also to the north of our city, north of Ukiah in particular, with more supportive housing for farm workers, as well as other documented groups that do need that supportive housing, that foundation to really ensure they have an opportunity to not only work in Mendocino County, but to live in Mendocino County. And we are going to otherwise undertake the action items and goals that are contained within this housing element. If you do a careful review, you'll see that there are a number of items here that really will help to spur housing, both with regards to accessory dwelling units, as well as to things as basic as weatherization programs that can be supported by our building inspector to ensure that the housing is not only constructed in a manner that's sustainable, but also affordable. As we think about rising utility costs, our ability to support weatherization efforts and green building is something that's going to be critical. So across the board, one of our biggest things is to continue to support all of these programs, policies, and action items that are contained within this document. And there are plenty for us to continue to work on and ultimately document. That is one of the critical facets here that has not been done previously. But I think, as you can see by these annual progress reports that were not submitted previously, if we don't tell the state or, our supervisors such as yourselves, how we're doing, it's hard to actually take credit for those gains. So one of our, our most important things moving forward is continued documentation. With that, it concludes my presentation before you. However, myself, our Director of Planning and Building, Brent Schultz, Julia Acker-Krog, our Chief Planner, and myself are happy to address your questions and those of the general public as we move forward. Thank you.
And I would just, if I may, Julia Acker-Krog, Chief Planner, I just want to take a moment and publicly thank Jesse Davis for all of his work on this. He's worked tirelessly on this for the last really 2 years. It's been a 2-year effort. So I want to thank him as well as PlaceWorks for their help, and also HCD for helping answer our questions and really guide us to get to this point. And with that, we are available for any questions.
All right. Yes. Thank you very much for this, getting to this point. Any comments or questions?
I have a question. One of the slides alludes to each jurisdiction being allocated its fair share. How do we figure the unincorporated's fair share is so large relative to the incorporated areas? And is that a good idea to be planning more development in the unincorporated where services are very difficult and expensive to provide?
Thank you, Supervisor Williams, for that question. This is Jesse Davis, Senior Planner. The determinations for the regional housing needs allocation, that happened back in 2018, and it's primarily a function of the fact that Mendocino County, while expansive, still contains the majority of population, comparatively to our incorporated cities. Again, we did look into facets related to available land as well as supporting housing like very low income. So there was, to some extent, trading amongst the jurisdictions to ensure we aligned as much as possible income groups where they were most appropriate in terms of infrastructure support. But we did submit comment to the state as well as to MCOG with our concerns about this formula and the breakdown. Ultimately, we still feel that we are capable of meeting those assigned targets, much like we did in the 5th cycle. The development we see occurring specifically along Brush Street, as well as on KUKI and Lovers Lane, I think is indicative of the projects that will help us to meet the numbers assigned to us in the future.
So the question is more not can we meet the numbers assigned, it's do we agree with the numbers assigned? Is this the best plan? And I hear that it was approved in 2018, but looking at this item now, I mean, I question it. And I support every other element, but except that one, I just think it's too much in the unincorporated relative to the cities. And I think. Go ahead.
This is Jesse Davis, Senior Planner. I think yes, the breakdown is a dramatic increase from where it previously was. While I think that the numbers are best centered in our incorporated jurisdictions, I think there's an ongoing dialogue that we should continue to have with the cities themselves. And there's nothing to say that over the next few years, we can't continue to have those conversations. I will say that, and I note in the memo, the Department of Finance originally projected us a much higher allocation and was actually reduced 52% before we were able to come to an agreement with our jurisdictional partners as well as HCD. So we did push back and otherwise see the demonstrated increase in numbers, but ultimately this is sort of the agreement that we came to.
Okay, Supervisor Jordy.
Yeah, so the county and the cities have all taken a number of steps that go beyond state law to encourage accessory dwelling units, granny units, and that's one kind of moderate or even low income housing. But it's hard to define under state law, my understanding, because it's truly low income housing unless you have a deed restriction or some sort of covenant on the property saying it will only be rented to someone in that income group. But as a practical matter, when you have a small unit, it's not going to be rented to someone of high income just because of the size. So has the state allowed for any counting of those second units, those ADUs, at least when it comes to moderate income units generated in the cities and the county?
Thank you for that question, Supervisor Jordy. This is Jesse Davis. Accessory dwelling units are near and dear to me in part because one of the first ordinance amendments I brought forward was actually to facilitate them in our inland division. Moving forward, one of the aspects that we're going to be undertaking is to track income with all building permits to the extent that that information can be gathered. to understand sort of how these accessory dwelling units are being used, are they being rented, inhabited by family members, et cetera. But the state has allowed some aspects of accessory dwelling units to be submitted as part of our annual progress reports. We have drawn the line around 800 square feet in terms of units that otherwise would be considered moderate income. And again, I think moving forward, we're going to be able to create a more robust data set that kind of can clarify when we really are looking at truly low income rental units. But for right now, we feel comfortable assigning the moderate sized 800 square feet to our moderate income levels, just given, again, this very nature of size versus cost. As we look at our moderate numbers in particular, with our previous 2014 to 2019 table, you'll see that we average around 36 to 50 moderate units a year. Those are primarily manufactured homes or mobile homes, as well as those smaller accessory dwelling units. Larger accessory dwelling units have typically graduated to the above moderate, but hopefully, if we get better at tracking the income levels associated, we can move more into moderate or more into low where appropriate.
Okay, I'm noticing, Jesse, I'm noticing that in that report that Supervisor Williams was noting that for the unincorporated county, more than half of the total units are in the above moderate versus within the cities, it's a much more low income or very low. And so is that because of the coastal area and then also the size of the acreage associated with those parcels that are in unincorporated areas?
Supervisor Haschak, this is Jesse Davis, Senior Planner. It's actually the delineation of the state, particularly HCD, prescribes the income levels assigned to jurisdictions across that allocation. And so as a result, we ended up, again, taking on a few more as a result of just having available land. But the income levels are assigned to our regional government, MCOG, by the state. So that's where those numbers are generated from primarily.
Okay, and any further questions from the board? All right, so turning to public comment, we did receive that letter from Sage San Giacomo from the city of Ukiah. And any other telephone calls or comments from the public, Deputy Clerk?
I believe that there was one more piece of written correspondence that was uploaded to the item as an attachment. This was from SCRAM and HFFB, their correspondence. And other than that, there is no further written correspondence and no telephone calls received.
All right. Thank you. So let's see, are there any other questions from the board?
I have one. Mr. Chair?
Yes.
Go ahead.
No, Supervisor McCowan.
Thank you, Mr. Chair. Yeah, not a question so much. Well, maybe it is. Again, I'm still not clear that there's any disadvantage to deferring action to see if the city of Ukiah has comments to make. Because if they do have comments that could be addressed and they're not able to make them in this forum, I believe their option would be to comment to HCD. I'd rather be able to try and resolve any issues at the local level than go through HCD. So I would be willing to continue the item if the board supports that, and I would appreciate further explanation from the board of the disadvantage of not doing so. I'm not aware of any funding cycles that we would miss if this item were put over for a short period of time. Thank you.
And that would go back to planning and building. Do you have any comment to that?
So Julia Acker-Krog, Chief Planner, and our Director may also comments afterwards. You know, really, we've received our certification letter from HCD, so changes at this point would be sending us back into the HCD cycle and needing to review those. The document that's before you has not changed substantially from what was presented and adopted in December of 2019. And so, you know, I really do urge the board to please continue with this item today. Staff does feel that this item could be acted upon today.
And Chair, if I could add to the support of the chief planner, it's
this is Brent Schultz.
Yes, Brent Schultz, and this is a certified document. It's done. It meets state law. We've done, you know, changes to it. It's complete. And my concern is I'm working on CDBG applications with HCD right now. I don't know what applications Department of Transportation may have out there that could be impacted by this. And I would urge the Board of Supervisors to adopt the resolution adopting the housing element for 2019-2027. So we can move with those items that Jesse brought up, which really are going to be very important to the future housing projects that we are working on now.
All right. Thank you.
Chair?
Yes, Supervisor Brown.
Thank you, sir. Supervisor McCowan, this has been an ongoing process for quite some time. Supervisor Jurdy spoke to the MCOG process. We had this once last December 2019. And I'm sorry that City of Ukiah didn't realize it. I'm sure they could get, you know, just like anyone else on the notification process if you're really interested in specific document. But I also heard staff say it had been posted, and I believe they said 60 days. Not sure, maybe I heard wrong. But my comment too is it's the memo and page 7 and the added action 1.4a to empower the MACs to assist the county, I think is very important, and I really appreciate that. So thank you.
Okay, any further comments?
Chair?
Yes, Supervisor McCowan.
Thank you. It's my understanding that the city had requested to be on the notification list and apparently was not notified. I can't verify that myself, but that's my understanding. And there is the matter of there's a loose end associated with the housing element, and perhaps County Council can explain if that would affect in any way the ability to move forward with the updated housing element. Is it fully valid even if the loose end hasn't been quite tied up yet?
County Council, I think you explained that before, but could you say it one more time?
Thank you, Mr. Chair. I'm going to let Deputy County Councilor Kudrowski speak to this a little bit more thoroughly, but I believe the short answer is I don't know that it's going to have any impact on the action taken today. Mr. Kudrowski?
Deputy County Council Matthew Kudrowski. So before the board today is the housing element, and that's something that has its own section. State law dictates what's to be included within. Related to this are other issues that we may require amendments to a different element, the land use element. And those are things that planning is going to bring back in the future related to other aspects of the analysis done as part of the housing element process. So the housing element can move forward today.
All right.
Chair Haschak.
Yes.
Yeah, I have issue with the housing element. I don't support it, but I will support this item because even worse is having it come back at a future meeting. So that's one in favor.
Okay, we're going to, if there's...
I have one final follow-up, Mr. Chair.
Right, go on.
Thank you. So yes, we can move forward and we can adopt the housing element, but can we actually take an action relying on the housing element prior to this other matter being updated?
County Council.
Because if we can't take an action based on the updated housing element until the other issue is updated, I'm not sure that we gain anything by moving forward today.
Thank you, Mr. Chair. I would just say that the issues with respect to the land use element are the same regardless of whether the board takes action today or not. So there's essentially no difference in the need to bring that forward and to have that updated, and no difference in the ability to rely on the updated housing element versus the existing housing element.
All right, any further comments? Okay, we'll go back to planning and building. Do you have any final comments?
We have no further comments. Thank you very much.
Okay, we'll take it back to the board.
Move the recommended action.
Hold it. I gotta close the public hearing. Okay, so the public hearing is closed. Supervisor Williams.
With the public hearing closed, I move the recommended action.
I'll second.
Okay, any further comment? Okay, Deputy Clerk, could you conduct a roll call vote?
Yes. Supervisor Brown?
Yes.
Supervisor Williams?
Yes.
Supervisor Jurdy?
Yes.
Supervisor Hashcheck?
Yes.
And Supervisor McCowan?
Yes.
The motion carries unanimously.
All right, thank you.
Thank you very much, supervisors.
Thank you very much.
Yes, thank you for all that work on it. Okay, so agenda item number 5I, discussion and possible action regarding presentation to the Board of Supervisors from the Mental Health Treatment Act Citizens Oversight Committee on progress since the July 14th, 2020 update. Sponsor is the Mental Health Treatment Act Citizens Oversight Committee. Okay, is Allison Bailey on the line? Who's going to present this? Oh.
Want me to do it?
Allison.
There we go. I'm sorry about that. Yes, this is Allison Bailey with Measure B Project Manager. And we have, it's been a while since I've spoken to you about an update. So we'll go through the program itself and then go into projects. So as far as the Measure B program goes, we are working on the software and also the part-time personnel that you allotted us. Thank you. Michaela Miles, who is also works with, I believe, behavioral health in the front desk, is doing the part-time administrative portion of Measure B that was allotted. She is starting on minutes and calendaring and correspondence and is doing a great job. We are also looking at a former employee, Juanita. I'm not quite sure what her last name is, but she was referred by Dr. Janine Miller. And she already knows Munis, and she will be doing a lot of our estimates and also getting into some finer points of budgeting for us. In addition, we are working on several projects, as you know. One is for the training center, the Behavioral Health Regional Training Center in Redwood Valley. Right now, it's a little slow because we can't use it due to the pandemic. but we are still working on it with facilities. The plans for rehabbing the building have been completed and will soon be going through the planning department. And I believe we are also working on the MOU and business plan for the building and business itself. Another project that we've been working on, which is a great success as far as getting that pushed forward, thank you so much, is the CRT, which is the Crisis Residential Treatment Center in Ukiah. And we are in the pre-construction phase, which means we're leaving the design phase and then getting into the actual planning of constructing the building itself. We have brought on a company called AECOM, AECOM. They have been doing this for over 20 years. They've been absolutely delightful, great to work with, and very professional. We're in good hands. So we will have an RFP going out soon for some contractor to actually construct the building. And we have 4 different items, which are following this agenda item today, that Dr. Janine Miller will be speaking about for Measure B, which will hopefully be accepted and brought into our eventual strategic plan. And thank you very much for hearing me.
Okay, any questions from the board?
I have a question.
Supervisor
I like that we have some action, that there's some forward progress on actually getting services implemented. I think that's good. I think the public appreciates that. I do have a concern about an item that I had brought to the board last December, about 266 days ago, requesting that we put together a business plan that would cover the operational expenses of the facilities that we're planning to construct and operate. And that item was clear on the recruitment of personnel, the maintenance, everything that goes into running the facility. So almost 9 months later, we still don't have that. And the public is entrusting us and the oversight committee with $30 million of public money. I continue to feel concerned that we're going to spend that money until there isn't any left. And, you know, it's kind of however we spend it first, those items will get checked off, but we may not have a holistic plan, to meet the necessary continuum of services. And we might look back and say, well, we got some implemented, but we're not really getting the return the public expects because it wasn't the right mix. How do we move forward on that business plan? Do you want me to bring a new agenda item? If it's like a copy and paste of that one from 9 months ago, and maybe this time it'll stick? Or do we not have the resources in-house? Do we need to contract this out? What do we need to do to get a business plan? Like holistic, looking at, and Allison, I would like an answer from you, but I also don't want to put you on the spot. This came about before you, and I think it's larger scope than you can't take on all the responsibility for it. But somehow the board needs to take responsibility that we need a business plan.
This is Allison Bailey, project manager for Measure B, and it's an excellent question. And you're right. I'm not exactly new anymore, being about 6 months in, but I'm still new enough that I haven't had the amount of time to catch up with everything that has been done over the last couple of years. But Dr. Janine Miller and I both know, based on work product and past experience, that if we take whatever is agreed upon today, along with the CRT and Auditor Lloyd Weir's numbers and the Behavioral Health Regional Training Center, and we use the budgets that we have built for those so far, and we get help from Juanita, who's proficient in Munis, that we are not far away from knowing exactly how much each thing will cost. Once we have the operators in, they will be able to give us an estimate, a very close estimate that we can follow. People in facilities are extremely able and understand what it's going to cost to maintain these buildings and rehab or build them with the help of outside contractors. So I know we haven't delivered it in one piece, which maybe would have been ideal, but we have enough of the real numbers and a solid estimate and a good program budget from our auditor that we are very close. We can do this.
So when that comes back, it'll highlight line items, the individual personnel, the life of the roof, the gutters, a projection of what it'll cost for us to maintain over the next decade and to staff.
Yes.
With footnotes to the sources. Because some of the documents that we've seen, and I'm not putting this on you, I just want to be clear, this is not a complaint about staff. I think the problem may be that we don't have some of the expertise that we need. And, looking back, we probably should have outsourced it 9 months ago because it's domain specific, it's unique, and it's probably a one-time effort of putting the plan together. But the numbers I've seen have had a lot of assumptions, right? Well, about $1 million because that's about what it costs. We need to know exactly what it costs in our county. I think some of these facilities require personnel that we may not have available. Are we paying recruitment bonuses? How are we accumulating the necessary staffing? So, and then after you answer, maybe we could also get an answer from the executive office, because I think the item for the business plan was really directed at the CEO.
Yes, this is Allison Bailey with Measure B. And yes, I understand that there are a lot of nuances, and the nuances are different for each project, which is part of what makes my job so fun, but also what makes it so challenging to follow fiscally. And I think that yes, some of the numbers are estimates, and but most capital project budgets start with estimates based on past projects, and then get filled in with the correct numbers once materials are purchased, or the contractor's hired, or the operator is brought on. And we have been very careful to kind of aim high, be conservative with our numbers, so that there will be a pleasant surprise at the end, as opposed to one that is negative. And I agree that I do not have all of the expertise needed, but I think that maybe with all of the different departments we have to pull from in the county, that there is enough expertise there.
Okay, and CEO Angelo, did you have anything to add to that?
Supervisor Williams, could you please repeat your question?
Yeah. Are you confident that we will have a business plan in front of us soon? One that, if put in front of an auditor, would pass, that is credible, has footnotes, tells us what it will cost to operate the facilities that we're currently building?
So, Supervisor Williams, I guess I would question, is that direction from the board? And I'm not pushing back on the direction if it is. I would like to know.
It passed on December 10th of last year as direction.
So then, honestly, I would look at the Measure B committee and Measure B staff, which we know is only one person at this point. So if this board, and obviously that was a direction that you asked the board to take, and they did. So if this board wants a full-on business plan, then the Measure B committee, usually this board won't spend a dime of Measure B money unless the Measure B committee recommends it. So any way we do this, one, if you want a business plan, you'll get a business plan. If you want a business plan that has specific components, then we certainly could work on that. If you are directing the executive office to do the business plan for Measure B, certainly the executive office will take that direction. Based on what you're asking, I think that we would work with the mental health staff, and certainly Allison as the project manager, and assist them in putting together a business plan. I don't know that the executive office could put a business plan together for the Measure B committee or the Measure B projects. These are mental health projects. So we need a level of expertise from mental health. So, honestly, if this is what the board wants, and I'm not pushing back. I actually think it's a really good idea, but I think that we may have to hire someone to come in, or between the mental health staff and the executive office staff and the auditor, we could put something together. I don't know about a time frame, and clearly, what may be a good idea is that the board forms an ad hoc to work with the Measure B staff in developing the concept of what you want for the business plan. I mean, you're right. We have $30 million. It's a finite amount in reality. And what is that money going to pay for? And how are the long-term operational costs going to be paid? I don't think there was ever any belief that the Measure B money would cover everything and would pay for all of the maintenance and all of the operations long term. So I guess I would ask if, maybe the board would be willing to form an ad hoc that would work with the Measure B project manager to develop what you want in the business plan. And then does it go back to the Measure B committee to make a recommendation on paying for the business plan? Or is the county going to pay for it out of general fund? There are a few little things here that would need to be answered. But I will tell you, if this board is directing a business plan, that's what you'll get. We'll work on it. But I think there's some things that need to be answered. One,
I think what we had directed was direct the executive office to perform operational feasibility of proposed Measure B funded facilities.
and that was the direction of the executive office. It was the executive office because the Measure B project manager was there at the time. So the executive office does not have the expertise. I don't think there's any department that has the expertise to say what the operational costs of mental health services will be, except mental health.
If we want a business plan, do you think we should outsource the effort?
I think you should outsource the effort. Unless, I would say unless Dr. Miller, I know Dr. Miller has been working on this. So, what I don't accept is that the executive office, the planning department, Department of Transportation, that anybody could understand the operational costs of the mental health services, the multiple mental health services that the Measure B committee has been discussing. That can only come from mental health or come from mental health consultants. There's no way any one of us here, except I would say Dr. Miller and her team, that could actually tell us what those figures are. So this board directs that we'll do it. We need a little more direction.
Hey, Supervisor Jurdy.
So I'd like to add, I do think that the board has wanted to see this, and I would just add one extra piece, and that is that, funding sources can change over time. So what the federal government might provide today, 80% of the cost of a particular service, and the state may provide the other 20%, and look at breaks even. But what if that changes and the federal government withdraws some funds, or the state is broke and they withdraw some of the matching funds and the county is expected? So it kind of, I'm bringing that up because I've consistently brought up the idea that I think it would be prudent for some portion of Measure B funds not to be expended, but to be put into some long-term trust fund, so that the services that we're going to be adding to the basket of services in Mendocino County has that trust fund to balance budgets in future years, where I think it's pretty conceivable that state or federal funding could change. Because I think in the short time I've been on the Board of Supervisors, I believe state and federal funding has changed for some number of social services just in the last 7 years. And I think if we're looking long-term, 10, 20, 30 years, we should almost expect that funding at the state and federal level could also change in percentage and just in dollar figures for different mental health services.
Chair Haschak, I would like to comment. I think Supervisor Jurdy, you're accurate. You know, state and federal dollars and the purpose of those dollars, it changes every year. And then, of course, we know at this point, the state is projecting a $70 billion reduction over the next 3 years due to COVID and the impact of COVID. So we know that what we projected, and Supervisor Williams, I believe it was somewhere around $38 million, and you're talking $30 million right now. That could be right. The amount of tax revenue coming in from Measure B will be less. And does that mean less services? I would also like to say, in discussions with Dr. Miller, who I find to be very, very astute in all of this, is that the Measure B committee has never decided what exactly they want to do. So to do a business plan when you don't know what the services are, what the operations are, and what the long-term costs of those operations are is almost impossible. So, I guess, what I would like to say to this board is, and I sit on the Measure B committee, and I have to say it is, honestly, it is extremely frustrating sitting on the Measure B committee. And I don't think I'm alone. There's 11 of us, and I think at times we're all frustrated. But I believe the Measure B committee needs more direction, and I believe that direction should come from the Board of Supervisors. I would welcome, as one member of the Measure B committee, I would welcome this board forming an ad hoc and working with us on a long-term business strategy. I think that's an excellent idea. Or this board developing what you want to see as recommendations to the Measure B committee. There's not a dime of Measure B money that's spent unless the Measure B committee recommends it to this board. So if you want a business plan and that's the direction, I can tell you it's going to cost money, whether it's internal staff that are doing it or whether it's consultants. And so does that need to go back to Measure B for them to approve it? So, I really think that if this board formed an ad hoc to work with the Measure B committee on some of these issues, it might be very helpful. I believe the Measure B committee needs direction, and I sit on that committee, and I'm saying that. Thank you.
Okay, any further comment from the board?
Let me. Do my colleagues support a business plan? And I hear that we can't put a business plan together because we don't know what we're doing. I mean, it's all sort of one and the same. We need to figure out what we're doing. And even the 11-member oversight, I mean, I think we look at that and well-intentioned people who are working hard, but somehow it's not coming together. And it's kind of the elephant in the room. The public has entrusted us with $30 million and we don't know what we're doing. So we need to get past that hurdle. We need to be able to say, here's what we're doing. You could audit it. It's solid. It has footnotes. There's a plan. As Supervisor Jurdy said, there's a fund put aside in case the state and federal reimbursement changes. We need all of that. We need to be able to tell the public we're acting responsibly and we're getting this done. So however we get there, I'm happy to support it. I would serve on that ad hoc. I would support funding a third party to write a business plan for us, whatever it takes. But we can't stay where we are month after month.
Well, and I'll add in that when I talked to Allison yesterday, I think, and the question was, what about the RFP for the CRT? And, that do we have any bidders? That's one tangible thing that we're dealing with right now is a CRT. We've made the decision to move forward with it. And now we need to see if our assumptions about how it's going to be managed, what the costs are going to pan out. And, from Allison, it was like, we don't know if we've gotten any bidders yet for the RFP. So it's kind of hard to proceed when we don't know really if our assumptions are going to pan out like we've assumed, as far as our business plan. And I think what CEO Angela was saying is that she wants direction, and Measure B committee wants direction from the board to go in a certain direction. And I always go back to what was the original intent of Measure B? It was to build these facilities, the PUF unit, the CRT, possibly the CSU. It looks like the CSU is now off the table. But I go back to, how are we going to get that PUF unit built? What's the cost going to be? And then if that is the direction that the rest of the board or the majority of the board wants, what is the business plan to make that happen? You know, and are we going to have money to make it happen? Make those two facilities at least work, and then everything else we need can be filled in with the remaining money. But if we don't have remaining money, then we can't fill in other things. So I guess that would be the direction I would give to the Measure B committee. So,
per board direction, I think that there has to be direction from this board. I mean, so if you directed me to do something and I just started and it was costing the Measure B committee, at some point the Measure B committee would have to approve that money. So, it's almost a circle of what we're dealing with here. So if the board would form an ad hoc to work with Measure B staff, Measure B committee as needed, and you worked on developing a business plan and you worked on a common goal. You have 11 people. I'm not sure there's a common goal. And you're right, Supervisor Hashtag. There is the initiative, and we should all be able to go back to the initiative. But you have 11 people and you have 11 different interpretations, just like the 5 of you might interpret the initiative differently. So I believe this committee needs direction, and that direction is from the board. You are ultimately responsible, this board.
CEO Angela, do you believe Measure B is working today? Is this a success?
That's a loaded question, and I would say that it's taken a while to get to where we are today. I think that improving the services and developing services could have happened without Measure B. And I think there are many times that Measure B is an impediment to progress, not something that's a driver or a starter. And so I really believe we need direction from this board.
Would any of my colleagues be willing to serve on an ad hoc or accept me on an ad hoc?
Yeah, I certainly would. But I guess going back to the original question is, can we give direction to the Measure B committee about the overall goal for what we perceive as the intent of Measure B money? And do we want to pursue that PUF unit? Do we want to build the business plan around that first? I say yes.
I'll give you a second.
Any further comments on that, or?
I would just agree with what both of you have said. I think sticking with the core mission of what Measure B was supposed to be about, and just again my addendum. I think if we don't go too expansive in a new vision for Measure B beyond what the initiative said, there could well be some money that could be set aside into a trust fund to ensure that those core services are provided in the years ahead.
Fully agree.
May I say one more thing, Chair Hashtag?
Yes.
Regarding the trust fund, just I think a month or so ago, the board did approve a prudent reserve for Measure B funds. So we are putting some money away, in case something is needed in the future towards the end of our plan, or we run into something we didn't expect.
Okay, so if we go back to that question, then it seems like we have at least a majority right now saying, let's pursue the PUF unit and build a business plan around that. And we can do that with an ad hoc committee. And Supervisor Williams and I will be on it. Are we all right with that?
Chair Haschak, if this is Deputy Clerk Lindsay Dunham, if you'd like, I can read back the directive I have.
Sure.
Formation of an ad hoc, including Supervisors Williams and Haschak, to work with the Measure B staff and Measure B committee as needed to develop a business plan and formulate a common set of goals.
Well, I think that we wanted to give direction too, to work on it with the specific idea of developing a PUF unit and building that business plan around that.
To the clerk, you could just add the inclusion of developing a PUF unit to that, because the motion was inclusive except for that one piece, Lindsay.
Thank you.
That was actually a very good motion, Chair Haschak and Supervisor Williams. Did you get that, Lindsay?
I did, yes, thank you.
Would you read it back then, please?
Formation of an ad hoc, including Supervisors Williams and Haschak, to work with Measure B staff and Measure B committee as needed to develop a business plan and formulate a common set of goals, including the development of a PUF unit.
Okay, very good. Are we clear on that directive? So we should go to public comment before we proceed on this. Can we hold that thought and directive and go to public comment? And we do have public comments. So is Ms. McGordy on the line?
Yes, Chair Haschak, she is.
Okay, Ms. McGordy.
Hello?
Yes. Ms. McGordy.
Yes, sorry, the unmute thing. So there's been comments about how frustrating this is, and this is extremely frustrating to me because I served on the Behavioral Health Advisory Board for years, and we had recommendations for years that were along these lines that were ignored. And I'm so confused about the need for a business plan when Lee Kemper laid this out very clearly two years ago that was completely ignored. And if you were expecting someone from the outside to come in and help you make a business plan, it's not going to be him because he was ignored. So I really have a hard time figuring out what the problem is here. You know, the prudent reserve that the BHAB recommended, which finally was instituted at your last meeting in a minuscule amount. It was not what was recommended originally by the ad hoc committee of the Measure B board. So one thing that is really lacking is a supervisor appointed to the Measure B board. The other advisory boards have supervisors that are in an advisory capacity. They're not voting members. I do not understand, with the importance of this particular commission, why you don't have a supervisor appointed to it. They don't have to be a voting member. So that's what I have to say about your discussion so far. There's other items on the agenda that I would like to provide input to. Thank you.
I have a question for the speaker, if I may, Chair Haschak.
Yeah, Supervisor Williams.
So Jan, I think that your point about the Kemper report is good, but what's missing in there is how much of it can we afford to implement with the funding we have? And I think that's what the business plan is about. It's about taking those priorities, those recommendations, and devising a plan to implement as much as possible, but cost is an element. The way we're going right now, we're just going to keep approving items until there isn't any more money, and then we're done. That doesn't mean the public gets the best possible return on investment.
So one of the first things that Kemper recommended was to create a strategic plan, which was not done. And he did include the cost and things. It was very clear what he included. And he suggested, it wasn't possible that perhaps all of the psychiatric facilities would be possible. And as I keep saying, the PUF unit is the most expensive and possibly the most restrictive of all of the choices. So I think it would be really good to go back and look at Kemper's report and pay attention to the budget details that he included in his report, because I think a lot of the answers are there.
I appreciate that. Would you be willing to meet with the ad hoc and then we can report back?
Oh, sure.
Okay. Seeing no further comment from the public, we'll go back to the board. So we have this direction. Okay. Is there any problem with that direction? Lindsay, could you read it again one more time?
Absolutely. General consensus of the board to form an ad hoc, including Supervisors Williams and Haschak, to work with Measure B staff and Measure B committee as needed to develop a business plan and formulate a common set of goals, including the development of a PUF unit.
Okay. If there's no problem with that, we'll accept it. Okay, hearing none, we'll move forward. Okay. Well, thank you, Allison, for that. And we'll go on to item 5J. Okay. And item 5J is discussion and possible action, including approval of $340,000 per year over a 4-year period of Measure B service funds to fund 3 mental health rehabilitation specialist positions for a pilot mobile crisis program as recommended by the Mental Health Treatment Act Citizens Oversight Committee. Okay, sponsor is Health and Human Services Agency. So Allison or Dr. Miller?
Good afternoon. This is Dr. Janine Miller, Behavioral Health Director. Quick question. Do we want to take these one at a time? There are 4 items. I can go through all 4 and answer questions at the end, or do you want to stop at the end of each one?
I was going to take them one at a time.
Okay, I can definitely do that. All right, so the first item in front of you is a recommendation from the Measure B committee. These recommendations came in, Measure B had recommended that the Behavioral Health Advisory Board, NAMI, and Behavioral Health and Recovery Services Department come in with suggestions on where they see the community needs are and how Measure B dollars could be spent to address those needs within our community where we see a gap in services, specifically mental health services. The 3 entities decided to meet together. We didn't want to have a plan from each entity and then make it confusing if we weren't all succinct. So we decided that it would be in the best interest to have our 3 entities meet together and discuss what we felt were the top priorities from the mental health in our community and the mental health experts in our community of where we felt our service gaps were and what could meet the best needs of our community. I wanted to add that in that report, even though we're not going to touch on it today, we did note that a crisis residential treatment facility and a psychiatric health facility were part of our recommendations, even though they're not part of the recommendation we're making today. I just wanted you to hear that they were part of those recommendations. So the first item that we're looking at was a mobile crisis team. This is something that has been talked about, I would say probably for 13 years or more within Mendocino County. It's a common model used throughout other counties. It's really gained more use probably in the last couple of years. It started out with just a handful of counties. I think San Francisco and Berkeley were probably the top 2 counties who first started mobile crisis team units. And then we've seen them expand. Sonoma County has a mobile crisis team unit. And so what the focus really is to do a law enforcement and behavioral health and recovery services would develop a mobile crisis team to provide crisis-related outreach and engagement, as well as respond to 911 requests regarding possible psychiatric or emotional crises within our community. Our goal is really to promote consultation, crisis assessment, engagement of the individuals in need, while seeking alternative treatment resources when appropriate, and including referrals to mental health services within our community, hopefully to reduce the number of 5150s that are written. As some of you may know or not, a lot of times law enforcement writes a 5150, we then transport the individual to the local ER, and then that 5150 can be rescinded. And so now you have someone who's gone into the ER, taken up emergency room time, staff dollars, And then you have an individual who is released from a hold and sometimes doesn't even have a way to get home. So then you have to worry about, we have to figure out transportation. And then sometimes that ends up, the person ends up back in the, back on a hold and back in the ER. So we're hoping that this would actually reduce those holds that would be rescinded, that more holds will be upheld. It will decrease the use of 911 for non-emergency users and decrease emergency room visits. Increase education for law enforcement about effective ways to de-escalate and interact with community members that have a mental illness, and really hopefully increase community member satisfaction and services. We are asking for $340,000 per year for 4 years for a total of $1,360,000. This cost is specific. We broke this down. This is actual cost that we looked at based on what it would cost to cover salaries, benefits, direct and indirect costs, and supplies. These individuals would work directly with the sheriff's office, not supervised, but would work directly with the sheriff's office, would be training with the sheriff's office. They would also be training with mental health and really be a team and be going out in their vehicles with them. We would expect some data reporting to come back to Measure B at least every 6 months, which we would be looking at number of 5150s written by law enforcement that are upheld, number of 5150s written by law enforcement in general. So how many are they writing? How many are they rescinding? How many are being upheld? Number of community members who receive engagement and total engagement. So we want to see how many people we outreach to, and how many there are unduplicated versus duplicated. So we see whether our community outreach is working. And then really looking at transportation and the total number of transportations. Are we transporting? How are we helping that? What's going on with that? We would also be, during this 4-year time period, we're really working with law enforcement and mental health to look at what are some future funding sources that we currently don't have in place for this type of model of treatment. So really doing some more research on what Medi-Cal could or could not pay for in this model. It is limited, but we may be able to find some options. Looking at mental health Medi-Cal administrative activities, which is another piece of Medi-Cal, but looked at differently, what options we would have using that funding. Looking at what we could work with private insurance companies, because we would be outreaching to private insurance companies and working with their clients and actually helping them prevent higher levels of care, saving private insurance companies dollars by doing that. We'd also be looking at grant funding and any other additional fundings that could help us fund this program after the 4-year period. And I believe that Sheriff Kendall was going to be on to talk about this piece. I do not know if he is available, and I know he wanted to add something to it.
Sheriff Kendall. Not hearing from Sheriff Kendall, I certainly have had some discussions, and certainly around this, the Public Safety Advisory Board, we've had discussions about this kind of configuration. And I know that Sheriff Kendall is very positive about it. So I see Sheriff Kendall.
Thank you, Supervisor Haschak, members of the board. I think that this approach is going to basically reduce any service gaps that we see due to a reactionary approach, and it's going to move us into a proactive approach. And so when we look at the different issues that we're facing, we can have a proactive approach or we can have a reactionary approach, and it's pay now or pay later, but later always comes with interest. It's more expensive to treat someone when they're truly in crisis than to be proactive and keep them from going into crisis. The national narrative regarding police intervention into mental health is really truly what sheriffs have been asking for years and years. We have a very limited bag of tools that we take out to these problems, but by partnering with behavioral health, we have just expanded the tools that we have. There have been many times in my life where I've had to, fix a tractor or a beat up Jeep or something with a flat rock and a bent screwdriver. Okay. And it will get me home, but it's still not right. And honestly, the national narrative, I think, is a good one, that we need to stop trying to fix things with baling wires and flat rocks. We need true professionals out there to deal with these things. Behavioral health has a much bigger bag of tools, but they need the protection to be able to do their jobs, because let's face it, some of the things that we deal with simply aren't safe. And if the sheriff's office can carry that water and we can come at this from a different point of view, not their problem, not my problem, but it's all of our problem, I think that we're going to see better service throughout the entire county with that proactive approach as opposed to one that is reactionary. Those are my thoughts on it. Thank you.
Okay, thank you. Back to Dr. Miller. Any further comment?
Yeah, I would just add one of the things I wanted to add really quickly, and because it's going to be mixed in because all 4 items were sort of in the overall budget projection. But I really want to say that when we look at these programs, we really took into, in this program specifically, but when we looked at the programs, we really looked at our budget. If we funded these programs for 4 years, this one in particular, would we have money still within the service dollars? Because this is really from the service dollar pot. This is not from the facilities dollars pot. Would we have money left? Because there's always that concern. Are we going to be able to fund these services and still fund our other facilities like a PUF or a crisis residential treatment? We did take into that number what we assumed a PUF would run us if we were paying the most out of Measure B, which we project of $500,000. We know that if, a crisis residential treatment, we recently put out I believe the RFQ is going out today for the psychiatric health facility. And so it should be posted today, and our deadline to have them turned in is November 5th. So we should have more direction on November 5th for the PUF. But with all that said, we know it's going to take a couple of years to get a PUF built or renovated, get certified, and go through. So when we look at that and knowing that most PUFs can really sustain on their own and not require county funding if done right, we still have, even after funding all 4 of these projects, $5.2 million sitting in a reserve to fund either additional services in 4 years or to look at to fund the CRT and the psychiatric health facility. So thank you.
Hey, Supervisor Jurdy.
Well, I liked what I heard, and Supervisor Hashak and I both heard some examples that Sheriff Kendall gave about how this kind of a service would be beneficial for law enforcement and the public. One thing I wasn't too thrilled about was the idea that we would fund this for 4 years entirely out of Measure B funds, and then after the 4 years we would seek other funding. And I think I'd like to hear that staff is going to be pursuing other funding, in the first 6 to 12 months. Wouldn't it be great if we could get other funding sources to pay half the cost of this service within a year? So I think we should set our aim a little higher here in terms of when we're going to seek out other funding besides Measure B funds.
Mr. Chair.
Chair Hashak, you're muted.
All right. Supervisor McCowan.
Thank you. I'd like to go back for a second to the psychiatric health facility. So the RFP is going out today for that. Is that what I heard?
Yes, the RFQ for the psychiatric health facility / psychiatric hospital / psychiatric unit, because there's 3 types of facilities, and we can get a request for either of those 3 types of facilities based on who's operating them and how they plan to operate them. It's supposed to be posted today was the update I got, and the request for qualifications would be due back November 5th.
Okay. And then if something is received back that looks promising, then we would still anticipate, then what would the process be from there?
The process from there would be to work we would look to see, find who we think is the most qualified to work with. We would then work with them to really define what they were looking at building, what they think the cost would be, obviously involving Measure B and the Board of Supervisors in that process, but looking who's qualified, what we have, who's coming in to say they want to build a facility, and what their overall cost would look like for us if we work with them to build that facility.
And potentially we would be giving direction to go forward with that before we had the business plan that we just discussed?
That's a possibility. And of course, you guys could decide to hold off on that and wait for the business plan, and just know that we had some people interested in building a facility within our county, and have some proposals on what the numbers might look like for the business plan.
Thank you. And then with regard to this item, so if I understand, we would be pairing a mental health professional with a deputy sheriff. Is that accurate?
That is correct.
And would this be limited to operating within the unincorporated county jurisdiction, or would it also be authorized to operate within the city limits?
So when we originally proposed, it was to start a pilot project with the sheriff's office and really get it in place before we rolled it all the way out. Measure B wants to see that we're consistently looking at it every couple of months to see, is it working? And can we roll it into the city limits? So there's no stopping it from rolling into the city limits. We talked about really starting it at with the sheriff's office to start it, make sure we have policies, procedures in place. We have everything up and running. We need to talk about staff safety, staff training. We really want to make sure we've done it right before we roll it into the whole community.
And then rolling it into the whole community, would that involve additional funding beyond the $340,000 per year for 4 years that we're discussing here?
It definitely could. It could require more dollars to roll it into all the different communities. I would say that we are going to be looking at funding right away. We're not going to hold off. One of the things I've always said to Measure B and any of these projects, if we can bill Medi-Cal for it, we will. If we can put it under a different service, we will. We don't always have the option to do that. But if I can bill it, I will bill it, and only bill Measure B for what we cannot bill for. And so that will be the approach for anything we do. If we're able to find that we can bill it and be able to fund it better, we may not need to come back in a year or two and say, hey, if we want to expand, we need more dollars. It's just something I can't answer at this time. It may need that, it may not.
Right. And I find myself in the odd position of actually having advocated for mobile crisis teams since the Mental Health Services Act was passed, and I participated in a lot of the meetings that made recommendations on how funding should be used, and this was actually one of the items that was recommended. It never did come into fruition for a variety of reasons. And I've also been advocating the last couple of years to move forward with services, even while we discussed how we would move forward with facilities. But I believe that the county paid $50,000 or so to have Lee Kemper do a gap analysis and make recommendations on where should the money be spent in terms of facilities, but also enhanced services. And I know there's been a lot of discussion by Measure B committee about the Kemper report. I'm just wondering why the Kemper report wouldn't have been followed as a blueprint, or how do we start spending service dollars?
So I can tell you from the 3 entities that came together, we did follow Kemper's recommendation. There's not a single item that we brought forward that isn't outlined somewhere in Kemper's report as needed services. So Kemper had recommended in his report that we increase mobile outreach, the MOPS teams. So we're taking we're still looking at that, but trying to look at how to make our MOP teams more effective. This adds that piece. He agreed that we needed mobile outreach. This allows us to do mobile outreach as he's recommending, but more effective than we are today.
However, it's not on his proposed Measure B strategic financing plan, neither mobile outreach nor MOPS, which are actually 2 different entities. It's I believe the purpose of the mobile outreach team differs from the purpose of MOPS, which was visiting known individuals. But I guess that's what I find missing are the details of exactly how would this team operate. They show up, let's get together at 8 a.m. at the sheriff's office and we're going to drive around, or we're going to wait for calls to come in. Do we know how this would function on the ground?
So you're right. There is a little bit of difference between MOPS and mobile, and so I just want to. The big difference for the mobile, the MOPS is that they still get referrals from the community, and they still respond when there's a need. Hey, that someone says, "Hey, we have this individual. They don't seem to be doing well. Could you please come out and work with them?" They also involve having a sheriff technician with them. We have been unable to fill the sheriff technician and work at that level to really make that team have the safety that they need when they are going out. And so we have not filled those teams and haven't been very successful at filling those teams because of that piece. They do hold a 5150 card. They can respond and do 5150 assessments. That wasn't our biggest approach and our biggest push for that team. It was really connecting, trying to get people de-escalated, get services prior to needing the higher level of care, but they do have the ability to do that. This adds a little bit of a different component in taking it further and making sure that we are responding to situations that do sort of similar situations. If there's a requirement that there's someone who's not doing well in the community, they would go out as a team. They would report together. They would be working together. I think Sheriff Kendall can let you know. I think he has some stats on the number of calls they respond to that actually having a mental health person available with them would actually reduce and de-escalate the situation. They do a lot of domestic violence calls where mental health can actually add a piece to that. They have a lot of crisis situations where if you had mental health there to work with the person, you probably wouldn't have the sheriff's office going back 2 or 3 times. It's going to reduce 5150. So they're going out with the sheriff on those calls that really need those specific calls that need a mental health intervention. You've got a lot of, and substance use intervention. So it really does allow for a team approach similar to what we had hoped with MOPS, but actually a higher crisis level than what we did with the mobile outreach program. And we just wanted to add, we actually have some models we've been working with. I know Sheriff Kendall has worked with Butte County Sheriff, and they've shared their MOUs, their models, and those are kind of what we're looking at to build this program off of.
Thank you.
And if I could ask Dr. Miller that, okay, there's a Measure B money, but within the mental health budget, there's not the staff or the money to start this program.
There is not. And as you know, our mobile teams were based off of grants. So when we brought the mobile outreach and prevention teams to you, they weren't funded either. We were able to get grant funds to fund those programs. Those grants are all ending. So we are looking at our mobile teams also disappearing unless we come up with an alternative funding. I'm not asking this specifically to fund that team, but we are looking at those teams will probably end up also disappearing unless we're able to secure additional funding. Because our funding is really based on Medi-Cal, most of our funding, it has to be a Medi-Cal billable service, and outreach just really isn't a Medi-Cal billable service. So we are looking at how to increase some other services, some other funding revenues that are out there. We don't have the funds to do that. And I think, just to add in, COVID has made our financial reality even worse. So mental health, took big cuts in MHSA. I know everyone thinks MHSA, Mental Health Services Act, can fund the world. Every time we look at legislation, they want to have it fund something else. And we're always fighting it because it funds the services we have, and they always want to redirect those funds. We lost money in MHSA this year because of COVID. We're projected to take a 20 to 25% hit in MHSA over the next 3 years. So the money that mental health may have had to even consider some things, one, we didn't have it, and now we really don't have it.
Okay, are there any further questions from the board before we take public comment?
No, just a comment between Dr. Miller, the oversight committee, the sheriff's endorsement. I think it looks like a solid plan. I understand it competes for funds, which ultimately could mean we don't do a puff, but I think that's already been considered. This is seen as a high priority. So I support it as is.
Okay, let's go to public comment. Ms. McGordy on the line?
Yes, she is.
Hello?
Yes. Ms.
Yes.
McGordy.
Yes, thank you. So the mobile outreach, I think it's really appropriate for the demographics of our county because we're so spread out with such a small population. And when the Behavioral Health Advisory Board first studied the Kemper's report, this was the first service that popped out that would be the most beneficial for our county. So we recommended it to your board. I brought it to Measure B board. It was recommended by the Measure B board to your board, but it was never approved. So I think that, as I said before, it's the most beneficial and first thing that could help things. Now, a partnership is really important, so I'm really grateful for Sheriff Kendall to recognize this. And in the prior program, the MOPS team, lots of times it was unsupported by the sheriff's office, so we didn't have a real team available. But a team is really important here. You know, the CIT's recent international conference was held visually last week, and there are many appropriate workshops that could benefit in raising knowledge of how this works, because crisis intervention teams is what CIT is. So when you go out with a mobile outreach team, you have specially trained law enforcement people who have, you know, more tools than a rock and a screwdriver when they're approaching a crisis, in addition to having a mental health person with them. Let's see. Yes, so I'm hoping that your board will finally get around to approving this so we can pilot it and see what good it can do for our county. Thank you.
Thank you. And I think my understanding was it never did come to the board before.
No, it came to the board. I brought it to the board. It was in our recommendations. But maybe you want
Mr. Chair.
Yes, Supervisor McCowan.
Thank you. Actually, it never was presented to the board as an agenda item for adoption. So it's something that certainly would have been discussed during public comment, but the recommendation of the Measure B committee was never presented to the Board of Supervisors as an agenda item. So I do believe you're correct, Mr. Chair.
Okay, thank you. So any further comment from the board? Okay,
I have one more comment, if I may, Mr. Chair.
Go ahead.
I'm concerned to hear Supervisor Williams say, well, gosh, we may not have enough money to ever build a psychiatric health facility, so we might as well go ahead with that. And that's a very crude paraphrase, but I would not be supporting this if I thought it meant that we would not be moving forward with a psychiatric health facility. When Sheriff Allman brought this issue forward and campaigned for it, other than the training center, the only other thing that I think everybody thought is actually going to occur would be a psychiatric health facility. And I understand there's challenges with what will it cost? What will it cost to staff it and maintain it going forward? Can we afford it? I'm very aware that those are very valid questions, but I really believe that the county would be breaking faith with the public if we did not do everything in our power to see that a psychiatric health facility is constructed. Thank you.
Chair Haschak. The difficulty is we're looking at items 5J and 5K, which represent $690,000 per year. We may only have about 1.8 million to work with. And so there's a hope that if we build a structure and a qualified provider will decide to come and lease it from us for $1 and operate a puff. But we don't know if that'll happen. If it doesn't, we may need to subsidize it. If we've spent this $700,000 a year, we don't have the funds to subsidize it. By not having a business plan in place, this is the predicament we're in. We have these good recommendations, solid services, low-hanging fruit, all the parties lined up to support it. We have to decide today whether we support it. But by doing that without a business plan, we are potentially jeopardizing a psychiatric facility and that we won't be able to operate it because we've spent the funds on other services.
And I think that point is well taken, that certainly we have agreement that this would be a great program, that it's great to hear that Sheriff Kendall is on board with it. He's done the investigation, sees what's happening over in Butte County. We've talked about that, and that there's a lot of potential. I've heard about it from the Behavioral Health Advisory Board. And, let's keep moving forward with this, the MOPS or the mobile crisis or whatever form it takes. And it seems like we have agreement that that's the way to proceed. At the same time, we have this lingering question about the overall finances of Measure B. And that for me is a big concern. So, any further comments?
Well, yeah, I don't mean to hog the mic here, but I'd like to hear from my colleagues. Do we support continuing to allocate funds and commit, even though we don't have a business plan and it may cost the facility? Or do we wait until we have the business plan? I think that's the question, not these individual items. Of course we support these are solid recommendations, but do we do it at the cost of crippling other good ideas?
Mr. Chair?
Yes, Supervisor Brown.
Thank you. I'm in support of moving forward. It shows progress. It's people inspired. I don't want us to be stuck in the mud or stuck, not going forth with services that help the mentally ill in this county and help our law enforcement and help other professionals, our emergency rooms. I feel we have no other choice.
Okay, any other comments from the board?
Yes, Mr. Chair. I don't find that the package of recommendations in front of us really lines up that well with the Kemper report. Again, in his strategic financing plan, he specifically called out substance use disorder treatment services, full service partnerships expansion, support service expansion, supportive housing pool. It's difficult to draw a line from the items recommended to those items. And that does concern me. I may very well be supporting this item before us. Some of the other items, it's going to be pretty tough. And I think Supervisor Williams does ask a very valid question. Should we be moving forward at all without the business plan, which really should have been developed before the measure was voted on? And you have been calling for it for going on a year, it seems like. The board gave direction to have that plan, and we still haven't seen it. So I really am concerned about passing this entire package, because that will reduce the funding that will be available to provide services ongoing. And I guess one final question. So we're to fund 3 teams, and I would assume that we have in mind that there would be some geographical diversity for those teams. Perhaps one would cover the North County, one for coastal areas, one for inland. Is that part of the intention, or have we gotten that far with what this would look like?
Dr. Ginny Miller. So yes, we definitely intend to make sure we have enough services throughout our community. And one of the things I didn't touch on was, it's one of the reasons we aren't focusing on city law enforcement as the first thing, besides that we want to roll it out, is that we know our outlying areas have the least number of resources. So we really wanted to make sure that we're getting these 3 teams into those areas that need the most services, because the local mental health services aren't directly in those areas. So, we have a lot of services in Ukiah. We have a decent amount in Fort Bragg, not as much as Ukiah, obviously, but we know our outlying areas are where we need that additional mental health support and where law enforcement needs that additional support with mental health services. So we really are looking at those outlying areas, and that's one of the reasons we're starting with the sheriff's office first.
Thank you.
What if we were to table these for like 60 days and bring them back after the ad hoc committees have time to work on this business plan?
I would support that.
Yeah, I would support it.
Okay.
Chair Haschak, would you mind rephrasing that to halt the expenditure of Measure B funds until we have a business plan approved?
Well, yeah, we could do that. Why don't you make the motion since I'm chairing the meeting?
I move we halt expenditures of Measure B funds not already approved until a business plan has been approved by the Measure B oversight and the Board of Supervisors.
I'll second the motion.
You seconded it, Supervisor Judy? Okay. Any further comment? Okay, so that would, if approved, that would deal with items 5J, 5K, 5L, and 5M. Is that your understanding, Supervisor Williams?
Yes.
Okay.
Mr. Chair.
Yes, Supervisor McCowan.
Thank you. Well, I was just about ready to make a motion to approve the mobile outreach teams. And I'm actually not ready to approve all of these, but I certainly see the value of that one. It's been identified as a need for over 15 years, I believe. And I would be willing to support that if there's the votes to move forward on it today. I do think we should take a harder look at a couple of these other items. So I would not support the motion currently on the floor. Thank you.
Okay, any further comment?
I would like to ask Supervisor Williams who made the motion, would he amend it to allow for the adoption of a separate vote on the crisis team?
Yeah, if I could start over, I move we approve the recommended action on 5J and halt expenditure of Measure B funds not already approved until a business plan is approved by the Measure B Oversight Committee and the Board of Supervisors.
And I second that motion.
Okay. Any further discussion? All right. Deputy Clerk, could you conduct a roll call vote?
Yes, just please give me a moment to catch up with all of those changes. Thank you.
I'd just like to make a statement.
Yes, Supervisor Brown.
I do think the other items should be discussed. We have a Measure B committee that is bringing items forward. Nothing came for a very long time. That's the biggest disappointment I've heard from the public. You're doing nothing. And so, although I support Jay, but I'm going to be voting no on the rest of the motion.
Okay. Mr. Chair, if I may, I'm just a little bit confused as to the impact of the motion and sort of where we are procedurally. It sounds, if I understood correctly, I think that the board may be looking to sort of take action to essentially not approve the expenditures on the other items today. And the one thing I just would want to address on that point is I believe we've got public comment for those items. So I would suggest that the board, prior to taking action, allow the public to speak to each of the items on the agenda.
Chair Haschak.
And I'd like to ask that the motion be withdrawn.
Okay.
Chair Haschak, what if we were to vote on this motion? We can still hear the other items. And should we choose to vote in favor, we could fund them or not.
Well, I think County Council is saying since this motion would affect how, the action on the other items, then we need to hear the public comment on those too.
Can we merge these items into one and hear that comment now while the motion is on the table?
Let me ask County Council.
I would say that's the chair's discretion. I believe that would address the Brown Act concerns. You just have to give the public a chance to comment prior to voting on the motion.
Okay, so we will go.
Mr. Chair.
Yeah, Supervisor McCowan.
Well, yes, technically that would fulfill the requirements of the Brown Act, but we're essentially telling the public, you can comment if you want. We've already made up our minds. I think it would be more appropriate to, and this would be up to the maker of the motion and the seconder, but I would request that they withdraw the current motion and instead make a motion simply to approve the item before us. And then I think that would probably pass unanimously. And then I would recommend we hear the other three items all together, and we could, hear the presentation, hear the public comment, and then deal with that, all of them in one motion if the board wishes to do so. But I would very much appreciate if we could have a separate vote on the item currently before us. Thank you.
Okay, Supervisor Williams.
I would prefer we just put it to a vote.
Okay, Supervisor Jordy, you're fine with that?
I'll withdraw my motion. I think it's cleaner to do what Supervisor McCowan suggested.
Okay, so we don't have a second on it right now. So, okay, going back to Supervisor Williams.
I move approval of, I withdraw previous motion and move approval of 5J. Is that the item? Yeah.
Yes. Okay. Is there a second?
I'll second the motion, sure.
Okay, any further discussion? All right, Deputy Clerk, could you conduct a roll call vote?
Yes. Supervisor Brown.
Yes.
Supervisor McCowan.
Yes.
Supervisor Williams.
Yes.
Chair Haschak.
Yes.
And Supervisor Jordy.
Yes.
The motion carries unanimously.
Okay, thank you. We're going to take a break right now. It's 3:43, so we'll break until 3:58. All right, so we'll be back 2 minutes before 4, and we'll discuss these other items. Order. So we're on to item 5K, which is discussion and possible action, including approval of $340,000 per year over a 4-year period of Measure B service funds to fund 3 mental health rehabilitation specialist positions for a pilot mobile crisis program as recommended by the Mental Health Treatment Act Citizens Oversight Committee. Sponsor Health and Human Services Agency. Discussion and possible action, including approval of $350,000 per year over a 4-year period of Measure B service funds to provide community education, awareness, and support services as recommended by the Mental Health Treatment Act Citizens Oversight Committee. So the sponsor is Health and Human Services. So Dr. Miller.
Hello, good afternoon. So do you want me, just direction, are we doing these one at a time or you want me to do the last 3 together?
Oh, I guess we were talking about doing last 3 together.
Okay.
So I guess I should read off agenda items 5L and 5M along with that. So hold on. 5L is discussion and possible action, including approval of a one-time allocation amount of $1,300,000 of Measure B services funds to purchase and renovate or build permanent supportive housing for individuals on the coast that are homeless, chronically homeless, or at risk of chronic homelessness who have a mental health condition, as recommended by the Mental Health Treatment Act Citizens Oversight Committee. And then we have item 5M, which is discussion and possible action, including approval of $260,000 per year over a 4-year period to provide follow-up linkage services to all individuals not eligible for Medi-Cal services being discharged from a psychiatric hospital stay or receiving a crisis 5150 assessment, as recommended by the Mental Health Treatment Act Citizens Oversight Committee. All right, so going to Dr. Miller and then Allison Bailey.
All right, so I'm going to first start with the community education, awareness, and support, and I will go through all 3 of them, but I will at least start with this one. This was again voted on by Measure B, brought by the 3 entities to really bring education, awareness, and support to our communities. One of the pieces of mental health that we lack in Mendocino County that are common in other counties is that additional education, awareness, and support that really gets put throughout their communities. There usually are entities that are funded to provide this additional resource. It's not a Medi-Cal billable service, which is why Medi-Cal can't pay for that. But it really allows for what we had hoped would allow for to provide countywide education, awareness, and support on mental health conditions, resources, and services. Ensuring that we focus on underserved communities and diverse populations, really doing community networking to promote community awareness of resources and services, training for professionals and non-professionals, which we know there's a gap in that within our community for sure, participating in community events, doing some public speaking around mental health, really trying to focus on stigma and discrimination, making sure that we distribute a lot of the material that's needed for resources, and then some education campaigns. This is, again, part of, as we know, that our suicide rates are very high. This would be a piece where we could work with an entity to really get those type of campaigns out there to really reach the general public, to educate them on resources and services that are available to them. This proposal was for $350,000 for 4 years. We also have a data collection that we would be requiring them to bring back to the Measure B committee. And we would be looking at additional funding sources, once again, not waiting 4 years, but really looking at, are there additional funding sources that we could start using? We look all the time for grants and other funding. That has not stopped. We do that on a regular basis, and we would continue to do that. And looking at the permanent supportive housing funds, this was, as Lee Kemper noted, we needed supportive housing in Mendocino County, and we were really looking at an option to be able to build more permanent supportive housing. This was really using service fund dollars, not facility cost dollars. and really having a permanent supportive housing somewhere on the coast. This was not specific to Fort Bragg. I know there was some confusion, but this was really being able to bring our coastal family members an option to house their loved ones somewhere in the coastal area. What happens today is they have to be housed in Ukiah, and it's a far distance for them to interact and have relationships with their loved ones when their loved ones are housed in Ukiah and the family is somewhere on the coast. So it was really to bring that housing and really support a permanent housing to them. It was a one-time allocation of $1.3 million, also service funds. We were looking to use that as seed money to get additional either grants, other types of funding, housing tax credits. This was specific. Why we asked for 1.3 is when we built Willow Terrace in Ukiah, Mental Health Services Act had $1.3 million to put up as seed money to build a permanent supportive housing. That is what we worked with RCHDC. We gave them $1.3 million. It was like 1.336 to build a 38-bedroom apartment complex. So, and that is what built Willow Terrace. We started the seed with 1.3 out of MHSA, and with housing tax credits and working with RCHDC, we were able to build that lovely apartment complex we have in Ukiah to house individuals that have a mental health condition and are homeless or at risk of homelessness. And so we were really using that as a jumping point, as additional seed money to be able to build housing somewhere in the coastal community for those individuals who have a right and have a need to have housing more in their communities. The crisis assessment and psychiatric hospitalization aftercare is the next one. And one of the things that probably impacts our law enforcement and our local ERs a lot is that people are assessed on a 5150, and the 5150, because they don't meet criteria, it's rescinded, or they come back from the hospital, and because they don't have Medi-Cal, they aren't followed up with by county services. As you know, county services are for those that have Medi-Cal and generally have a severe and persistent mental illness. So individuals that aren't followed up with by the county are expected to work with their local provider or local insurance company to have these follow-up services. One of the things we know is that doesn't happen on a regular basis, or they may come back or be lifted up, have the crisis assessment, and it may take 2 or 3 months to get into their local provider for services. And so now you have an individual who isn't getting the treatment and services they needed because their insurance company and their local provider isn't able to serve them as immediately as it needs to be done. This would allow us to provide services to approximately 412 individuals in Mendocino County who do not have Medi-Cal insurance. That's about approximately how many individuals we touched in fiscal year 19-20 that did not have Medi-Cal insurance and were either hospitalized or received a 5150 assessment and then did not get any additional services. We looked at these services being able to provide case management and linkage, so these people would not just be released, they would have additional services to make sure they're linked to their primary care or whoever the provider will be. We would be able to offer medication management, so if you had an individual who wasn't on psychiatric meds but needed them and couldn't get into their private insurance right away, we could get them a medication appointment, start them on medications, and then link them to a psychiatrist in the area or a provider in the area, and rehabilitation services. We believe we can serve, like I said, 412 clients. We have a detailed breakdown. It's based on about what we would bill Medi-Cal and how Medi-Cal would reimburse those services. If the service is reimbursable by Medi-Cal, obviously Measure B would not be billed. But these are really services that currently we cannot bill Medi-Cal for because they have a different primary insurance carrier. The request is for $260,000 a year over 4 years, with also data reports to follow up on to really see how these services are working, whether they're working well, whether or not we're providing the needed services. This does actually reduce the strain on law enforcement and the hospitals because they're not bringing the same person back over and over. And it's going to reduce an impact on both those areas and actually be a positive for both the clients, law enforcement, and the emergency rooms. We're hoping that we can use some of our data to really work with the private insurance companies to say, hey, this is actually a valid service. It's actually benefiting at your clientele. Here's what we're doing. Here's how it's benefiting. How can you help pay into this model to sustain it long term? also looking at grants and other types of funding to be able to fund these programs long term. And then lastly, I just wanted to add really quick, short of the financials, which is in the paper that you guys have at the back page. It really talks about the projected proceeds and what we would project these programs would cost and what we would have left by 23-24. And once again, I'll say that we would have $5.2 million even after funding these programs for 4 years. I know there's a lot of talk about we need to be able to fund a PUF, but I'm going to say if we cannot fund a psychiatric health facility for $2 million a year, which it should not cost us that, we can't afford to fund one. So I don't think not funding these services now is going to impact a PUF now or later. The fact is these services still leave $5 million on the table. And if it's going to cost us more than $5 million to fund a PUF, we don't have the funds to fund it now, nor do we have it to fund it 3 or 4 years from now when our proceeds are only expected to be at $2 million. So I just wanted to add that in because, I think we need to also think about the fact that we are in a pandemic. We have a community that is in crisis. We have mental health needs. We have suicide rates that are off the charts. And we have the ability today to bring services to our community, to provide some additional support and help the people of our community and know that we still have $5.2 million sitting there and by the fiscal year 23-24. And so thank you.
Okay, thank you. Any questions from the board?
I have a question on 5L. I see that the 1.3 million would be from the services fund. Why would building a structure be considered services? Using that logic that capital asset is a service, you could argue the PUF and the CRT, everything becomes a service.
We argued that it was supportive housing, that it's really a supportive housing model. We could have projected that it be facilities funds. It could come either one. I'm not saying it has to, but we weren't saying this is just housing. This is a supportive housing model that really is service focused. And that's the only reason we went there.
How much of the 1.3 is for capital assets versus running the facility?
So the 1.3 is mainly, I would say, all for capital assets. We would be able to bill 99% of supportive housing. Medi-Cal will support, and you can bill for those services.
And Dr. Miller, I had a question. I was reading an email or something the other day that Mendocino and Humboldt both got grants for $2.5 million for some of the education component for mental health.
Yes. So we participated in a competitive grant, and we were awarded, along with Humboldt, separately, obviously, $2.5 million over 4 years, I believe it is. And it is to do a blending of how to better have mental health services on your school campuses. Unfortunately, with COVID, we're kind of in this weird place where we're trying to figure out how we make that still happen. We are still going to work on the grant. We're still going to provide mental health services. But the real intention of the grant was to really get mental health services more on your school campuses.
Okay, so that's part of that component for 5K. Is that correct?
No, that's a whole totally different program and a totally different look at things, the grant.
Okay. Any other questions?
Yes, Mr. Chair.
Go ahead, Supervisor McCowan.
Thank you. So with regard to 5M, could you explain how that would differ from full service partnerships, and wouldn't these individuals potentially be better served if they had a full service partnership?
So full service partnership is not for people that have private insurance. So if you have another insurance source, it's actually not MHSA's focus. So full service partnerships is not an area you fall into. Because these individuals are mostly, I would say almost all of them, are people that have private insurance, they have Medicare, or they have veterans insurance. So they already have an insurance company that's supposed to be providing some level of service. That is why they're not Medi-Cal. They don't fall into the MHSA full service partnership category.
How would the services provided be different?
Well, currently they don't get services. So, what happens is you go in and the county is required to provide all crisis assessments, right? And so we go in and do the 5150 assessment regardless of your insurance type. What happens from there is based on your insurance type. So if your hold is rescinded, you're rescinded and referred to connect with your insurance company and whoever the network providers are within your insurance company. If you're hospitalized based on your insurance in a psychiatric health facility, and then you're discharged from that facility back to a provider and based on your insurance, you're supposed to be connected to services. We don't see that happen all the time with private insurance, but you're supposed to come back with a follow-up plan, which doesn't always happen. The difference would be that every individual who has a crisis assessment, regardless of insurance type, would be offered aftercare services, which we currently offer to every Medi-Cal beneficiary. So we offer you 60 days or more of follow-up care. We're going to work with you. We're going to connect you to resources. We're going to make sure you get your medications filled. We're going to get you a med appointment. We're going to connect you to whoever your provider should be if it's not us. When you discharge from a psychiatric hospital, you get an exit interview. We're working with you to make sure you have your medication. We're going to make sure you get a med appointment if you need one. We're going to then connect you to your right system of care, regardless of your insurance type. Today, that does not happen because it's based on your insurance, and your insurance is supposed to provide that service.
Thank you.
Okay, any further questions from the board? All right, we'll go to public comment. And do we have Ms. McGordy on the line?
Hello.
Yes, go ahead, Ms. McGordy.
Okay, so I know that your board has already pretty much decided that you don't want to fund these. So, but I just want to make a comment on a couple of them. First of all, the community education, there was a reference to the state grant for schools that our county got, which, I mean, I know that the department's really happy to get the grant because it was a competitive grant. I just want you guys to be informed that the money for those grants came from MHSA funds. So they took the money that would have come to the counties for MHSA for prevention and early education, and they made them into competitive grants. That's kind of what's happening at the state level. The other one is the aftercare, which is really important and actually affected our family because the follow-up, if you have private insurance, doesn't happen. For one thing, there's no psychiatrist in the county. So if you don't have Medi-Cal, you don't have access to a psychiatrist, who are the only ones that can diagnose and prescribe psychiatric medication. So you're kind of left. So this causes you to enter that, revolving door of going to the emergency room to be 5150'd, to be let go, and perhaps finally end up in the county jail for an extended period of time. So that's really an important service that could be offered with Measure B funding, because as Janine keeps trying to emphasize, the county only pays for severely mentally ill people who have Medi-Cal services, which doesn't mean that if you are not in crisis, you get anything. So that's a really important thing. And then as far as creating housing or I thought it was a crisis stabilization unit on the crisis residential treatment, some kind of housing on the coast. Because as has been said over and over again, the taxes that are created for Measure B, a lot of them come from the tourist industry that is centered on the coast. So the coastal people have been really adamant about wanting services over there for mental health. And yet it always seems to be centered in the Ukiah Valley. So that was really trying to address that issue. And I think that's what I wanted to give you. Thank you.
Okay, thank you. All right, so that was the only comment from the public. So it's back to the board.
Chair Haschak.
I do have one more comment, Mr. Chair.
Well, let's see.
Let's hear Supervisor McCowan's.
Okay. Supervisor McCowan.
Thank you, Mr. Chair. I do agree with Supervisor Williams. I think this proposed allocation of services money for capital outlay for housing is completely inappropriate, and I really don't buy the justification for that. Yes, we need more housing, but to say that using $1.3 million for a capital outlay for housing is providing services doesn't really wash. And I think if Measure B were to be on the ballot today, it'd be a struggle to get it passed. And the way this is playing out may make it very difficult to get anything passed. So, you know, I think we have to be very careful about what the categories are and where the funding comes from and make sure we can justify it. Also, I will go back to the Kemper report again, and I don't see that what is being proposed here matches up very cleanly with what Kemper proposed. And we would have been quite a bit further ahead if 2 years ago in August, when the Kemper report was presented, we had simply adopted it. So I am not prepared to support these other items today. Thank you.
Supervisor Williams.
I move we establish authorship of a business plan to implement the Kemper report as the highest priority for Measure B. And we table items 5L, 5K, and 5M until the business plan has been approved by the Measure B Citizens Oversight Committee and the Board of Supervisors.
I'll second the motion.
Okay. Any further comment? All right. And so just a clarification, the Kemper report proposes that we do a PUF unit. So that would be taking into that, using that as a priority.
I think voters passed Measure B because they saw a need. The Kemper report highlighted what we should implement. We need to analyze, can we implement it? Can we afford it? If not, what do we give up? And I think we need to bring that back to both the Oversight Committee and the board for approval. And then we can open the door to these individual items so long as they fit with that business plan.
Okay. Any further discussion?
Chair Haschak.
Yes. CEO Angelo.
I just want to make a comment. I fully support and obviously serve this board. I fully support what you're doing. I just want to make one comment about the Kemper report, because the Kemper report did evaluate the services and specifically the psychiatric facility inpatient, the PUF. But the Kemper report also said a key point of the Kemper report was that the only way a PUF would be successful is to have augmented services, mental health services on a daily basis for mental health clients. So I don't want us to put so much effort into the PUF without recognizing that unless there are wraparound services for these clients, if all we do is build a PUF, it will fail. There must be additional services on a daily basis for these clients. Thank you.
Chair Haschak.
Well, just a question for CEO Angelo. The CRT would provide some of that service too, wouldn't it?
Yes, it would. Yes.
Supervisor Williams.
I think today with this item, we're essentially adopting the Kemper report and committing to building a plan for implementation. And that recommendation, nuance is inherent in the action, and that we're not going to focus on how to build a PUF. We're going to focus on how to build a PUF in the other elements of the continuum. And if we can't do it, bring it back to the board to ask, what do we want to give up? But the starting point should be to implement the Kemper report recommendations.
Okay, any further discussion? Okay, Deputy Clerk, could you reread the motion?
Absolutely. I have a motion from Supervisor Williams to establish authorship of a business plan to implement the Kemper report as the highest possible priority of the Mental Health Treatment Act Citizens Oversight Committee, tabling items 5K, 5L, and 5M from today's agenda until such a time that the business plan has been presented to the board.
Approved by the board.
Did you get that?
Yes, I did.
Okay, very good. Could you conduct a roll call vote?
We do not have a second on this motion.
We had Supervisor Jurdy as a second.
I missed that. Thank you. Okay, roll call vote it is. Supervisor McCowan?
Yes.
Supervisor Brown? Supervisor Brown, you're muted.
Yes.
Supervisor Williams?
Yes.
Chair Haschak?
Yes.
And Supervisor Jurdy?
Yes.
The motion carries unanimously.
Okay, thank you. Agenda item 5N, discussion and possible action including adoption of urgency ordinance enacting temporary restrictions on COVID-19 pandemic-related commercial and residential evictions. Sponsor is the County Council. So, County Council.
Thank you, Mr. Chair. This is the item that the board asked us to come back with on this meeting after the last one. As the board is aware, the court's moratorium on issuing summons in unlawful detainer cases expires at the end of the day today. We prepared this urgency ordinance to fit within the scope of what the governor had authorized local jurisdictions to do under his executive orders, and made just a few modifications requested by the board. That being said, as of yesterday, the state legislature has passed new legislation addressing this topic that appears to preempt any local tenant protection specifically until February. We're still digesting everything within the recent legislation. I do have Deputy County Counsel Michael Mactasy here to present. To the extent that the board might want to go forward, it looks like this would be primarily relevant at least until next year and possibly at all, only as it would apply to foreclosures of properties that are not on federally backed mortgages. And I'll let Deputy County Counsel Mactasy sort of explain the issue there. At this time, I don't know that we're particularly recommending going forward with the ordinance, but I do want to be able to address any questions that the board might have at this time. And if I may, Mr. Chair, I'd ask if the board would recognize Deputy County Counsel Mactasy.
Certainly.
Good afternoon, Board of Supervisors. This is Deputy County Counsel Michael Mactasy. Can you hear me okay?
Yes.
Excellent. So I was signing on while County Counsel began the presentation, so I apologize if I repeat anything. Essentially what happened last night, well, let me back up. The reason why we were bringing this urgency ordinance was because the Judicial Council was going to end their emergency rules that were prohibiting evictions, which was going to expire today. And so this was going to provide protections for tenants against evictions for COVID-related hardships. As of yesterday, close to midnight, I think it was well past business hours, the legislature passed a statewide bill that would protect tenants under the circumstances that they laid out from getting evicted for COVID-related hardships. In that bill, it was primarily targeted towards tenants. However, there is other law out there, such as the CARES Act, that gives protections to people who have their own homes who are having a hard time paying their mortgage, including requesting forbearance. But as County Council mentioned, it only applies to federally backed mortgages. And so that's, from what I've seen, about 70 or 80% of the mortgages that are out there. So what appears to not have been covered between the laws that I've reviewed so far are the people that have homes that do not have federally backed mortgages. Now, I know that the legislature is aware of this. The chair of the Judicial Committee had mentioned this. I don't know if they're going to come back and do anything. So that's there. However, in this bill that got passed last night, one of the things that it said was any local jurisdiction that wants to try to create protections for tenants based on COVID-related hardships where they couldn't pay their rent would be not effective until at least February 1st. So anything that we do today that protects tenants is not going to have any effect right now. And I could, rather than going on further, if the board had any questions, perhaps I could answer them.
Okay, any questions?
Is it your recommendation that we table this item for now?
Mr. Chair, at this point, I would be prepared to recommend that we table the item and sort of see what the state does with respect to foreclosures and whether there appear to be any gaps or areas that would be appropriate for any local action.
I so move.
I'll second for discussion.
Well, we're still discussing and we're questioning. So any further question or comments about this?
Mr. Chair, if I may.
Yes.
My preference would be that County Council simply withdraw the item. I think 90 or 95% of what we were intending to do has been mooted by the action that the legislature has taken. And in fact, I think has probably gone well beyond what we were contemplating doing. I think the issue's probably muddled enough without us even holding out the intention that we would be reconsidering this at some future time. I think the legislature has preempted the need for us to act.
Okay, any further comment? Okay, we do have some correspondence on that. It's in your packet. It's attached from the North Bay Association of Realtors in Battenfort. So,
Mr. Chair, if I may, in light of Supervisor McCowan's comments, I will say I didn't want to withdraw this because I did want to give the board an opportunity to ask any questions or get any information or provide any direction that it might want. If the board would like, what we could do is simply, continue to watch, and if and when there's something that we believe is appropriate to bring to the board, we can do so. But otherwise, not having any anticipation that anything in particular would be coming back.
okay, is there any problem with just having County Council watch it and bring it back as proposed if the situation arises? Hearing none, we'll go with that direction then.
So we have I'm sorry, this is Deputy Clerk Lindsay Dunham. We have an existing motion on the floor. Did we want to withdraw that or?
Yes.
Supervisor Brown, did you make that motion?
I did. I can withdraw.
Okay. Very good. So we're all right with that direction to County Council? Okay. Hearing no complaints. Very good. You're good with that, County Council?
Yes, thank you, Mr. Chair.
Okay, moving on to agenda item 5O, Chief Executive Officer's report. CEO Angelo.
Thank you, Chair Hashjack. Very briefly, because of the late hour, I hope that the board has this electronically. It has been posted. The first page is around the human resources update, and we put this on here so that the board is aware of what's happening with our 1,200 staff. And you can see that really we do not have large numbers of staff that are on emergency paid leave right now because of COVID, and the numbers are right there. Additionally, the call center, we have had the call center up and running for months now, and every time we think that we could go ahead and take the call center down and send staff back to their departments, we find that there are still many calls for different topics. And now not only with COVID, people are calling the call center around the fires as well. And of course, with public safety power shut off. So we have a call center that remains active, and the call center is staffed mainly with county employees. County employees that, one, have been working in disaster over the last couple of years, so understand the call center, how to operate the call center and how to run it, but also staff from other departments that have powered down or closed because of COVID. So unfortunately, at this point in time, because the call center has gone for 8 months, like everything else that we've done in response to COVID, we do have a shortage of county staff. And so we have continued to recruit from all of the departments to fill the call center. But that is something that we are experiencing right now. And we are very appreciative of our staff that have continued to work in the call center nevertheless. And again, we do have a shortage of bilingual staff in the call center. So you may be hearing that. That's what's happening. I think overall that it's a difficult job answering the calls, because you can get a call on just about anything in the call center. And so you attempt to be prepared as you can, but you may not be. We have standard language that the call center staff do utilize, but still there are some areas that are really very difficult for call center staff to answer, particularly when people call and they want some type of medical or clinical advice. That's something that the call center cannot do. So we continue to work with the call center and to get additional volunteer staff for the call center. The second page, basically human resources update continued. There is a vacancy list attached to the CEO report. And then of course, on the second page, we also have our request for proposals update for this board. And you can see that part of what was discussed with Dr. Miller is the first RFQ there regarding the construction management services. And then you can see the rest that are there. I won't go into those at this point. We have an information services update, the technology advisory committee that the board is very much aware of and participates in. The IT master plan has been moving along, and the property tax software system project as well continues to move forward. And so you see that update there. On page 4, Health and Human Services, and I'm certain at this point that this board is aware that our Health and Human Services Director, Tammy Moss-Chandler, will be with us for a few more months. She's not leaving in September. She will be with us through the calendar year. So we're very pleased that Tammy will be staying and assisting us. And Tammy's scope that she will be working on as director will be more focused on some areas of critical need. And the way that the agency has been set up, Becky Emery and Dr. Janine Miller, along with Darcy Antill and Mary Ellis Wolford, are basically the leadership in the agency. And Tammy will be working closer with me. She's also working with Chair Hashjack with the initiative with Rosanna Barra, and she'll be doing some of those special projects that are areas of need, but we don't have one person assigned, and she is assigned. The Cultural Services Agency is the next item, and I do want to say that I believe that the board saw Karen Horner's email to you, which basically was kind of a a farewell email. And that this board does know that Ms. Horner is leaving county service. However, she's not leaving that quickly. We do have Ms. Horner continuing to work with us this calendar year, and she will be working on a contract. So we have staff within the library and certainly a point person in the museum to carry on in Ms. Horner's absence, but she is working with us, covering some of the administrative and the Cultural Services Agency Director activities that she was doing as a full-time county employee. The next page is the emergency projects, and this is important because throughout the course of the year, there are emergencies that come up, whether it's a flood or the roof caves in, something, and I have the authority as purchasing agent to go ahead and approve those, but really it's this board's authority. And so I don't ever want to approve something and make sure that this board doesn't know about it. So what you see here are projects that were emergency projects that were approved. The jail gate cost was less than $6,000, but a replacement gate was necessary, and we weren't waiting to come to the board and get the approval. We needed to move on that. The Sanhedrin power line, this is another area that's always problematic, and so we had to clear out some trees and some brush. And that's a project that's under $40,000, but it's still a project that we move forward with. And so this is notifying this board of these emergency projects. And then, of course, the HVAC system in public health. This is a project that was approximately $25,000. And then we have water damage to the administration center roof. I don't know the total cost of this. We continue to work on the repair of the roof and the repair of the flooding. We have we have our staff in planning and building who are not able to work in their offices because of this water damage. And so that's what you see here. That's that report. Page 7, just upcoming board meetings. Dates of interest, county holiday is on Monday. And then the attachments. And I will not go through those. There is an attachment from Health and Human Services, and certainly the Human Resources attachment, the position justification report, and the vacancy report. And so that is my CEO report for today, Supervisor Haschak.
Okay, thank you. Any questions or comments for CEO Angelo?
On average, how many calls does the call center receive?
I can't tell you now. Usually what happens is the calls spike during when we have new orders. So it's possible that they will get a couple hundred calls a day, or in a period of 3 days, the calls will be in the hundreds because of the orders. And since those orders have been continuing throughout the months, that's what we've been seeing, but usually around 50. So they're still getting calls.
Okay.
Mr. Chair.
Yes. Supervisor.
Thank you. With regard to the water damage to the administration center roof, I believe that took place during a forecasted storm event. So wouldn't the contractor be liable for not properly securing the roof area that was under repair? And does government ever seek to recover costs from the other party? Because potentially this is one that they, I think, were responsible for.
Yes and yes is the short answer, Supervisor McCowan. So I can report back to this board on the outcome of this, but yes and yes.
Okay, very good. All right, so we're going to move on to item 5P, which is the legislative update. And certainly we might have some news from there.
Yes, I believe that Sarah Duquette should be coming on. She should be doing an update, a legislative update. We talked about having that as long as there we go. There's Deputy CEO Sarah Duquette.
So item 5P is discussion and possible action, including review, adoption, amendment, consideration, or ratification of legislation pursuant to the adopted legislative platform. Okay, welcome.
Good afternoon, Board of Supervisors. I'll make this really quick as we're towards the end of the day. Last night, the legislative session ended at around 2 a.m. in the morning. There was a couple big ticket items for counties. One of them was around the Department of Justice realignment of some juvenile services to counties. Now, the counties and RCRC and CSAC worked really hard to push against this. Unfortunately, it was approved by a razor-thin margin last night, so that's moving forward. There was also some legislation, AB 6, which was around the opioid epidemic lawsuit that many of the counties are in. And we did a big push with RCRC and CSAC. We joined a coalition letter and sent one ourselves, are really against this bill. Luckily, it never actually went to the floor for a vote last night, so it's dead in the water. So that was a win for counties there. There was a couple other bills around funding for wildlife to combat wildfires and disaster preparedness that ultimately didn't make it through. There are quite a few bills of interest for counties that did make it through and going to the governor. So you'll receive a list from me of some items of note, and then we'll be getting from Paul Yoder and Karen Lang shortly a full list of all bills that are county of interest bills that are going to the governor. The governor has till September 30th to sign or veto the bills. So then we'll have a better idea at the beginning of October of bills that are going to require significant implementation by counties. And then as we're moving into September, we'll start the legislative platform process with the standing committees soon. And we'll be revamping the format as previously directed by the board earlier in 2020 before COVID. So we'll be working on that and you'll hear more from us soon. So with that, look for an email from me over the next couple of weeks updating you on the progress of county bills as we reach the conclusion of this legislative season.
Okay, thank you. Any questions for Ms. Duquette? Okay, hearing none. We'll go back to item 5A, which was the COVID-related one, and we had tabled the discussion about the letter that Supervisor McCowan had written and what to do with that.
I think if you're asking for input, I think the letter will only be effective if we have support from our health officer. Seeing what's happened where other rogue counties have had their supervisors go against public health has not been effective. And so if we're to make an argument and we want it to be compelling and shift state policy, I think we need to make sure that the board and public health are aligned. I would be happy to work with Dr. Coren to massage the letter into something that he could support.
Okay.
Mr. Chair.
I agree with that, Supervisor Williams, that it certainly would be advantageous to us to work with Dr. Coren in his first days in office as a public health officer and make it a collaborative effort. Supervisor McCowan.
Thank you. Well, I do support the letter. I think it would be ideal if Dr. Coren supported it. I don't think it's a fatal flaw if he doesn't. During the last 5 months, the governor has rolled out first the hard freeze, the one-size-fits-all lockdown, which I supported because I think initially that was necessary to hit the stop button. Let's assess where we are, where we need to go. So I believe that was appropriate. The hard lockdown continued too long, I think, and that ultimately led to the governor allowing, through the attestation process, many counties to open up prematurely. And I think that's where we saw the big spike in cases and in deaths. And so then we went to the watch list model. Now we've abandoned the watch list model for the new blueprint for a safer economy. Unfortunately, it is extremely rigid. It is one size fits all on steroids, and it will kill possibly hundreds of businesses in Mendocino County. And I don't believe that's an exaggeration or an overstatement. So what we're faced with is to create, honestly, sufficient public pressure that the governor will once again reconsider his position. He first walked away from one size fits all based on the advocacy of the public and local officials. And my hope is that he would do it again. And I don't think it invalidates the letter in any way if Dr. Koren doesn't immediately embrace it. And I do think it'd be beneficial for Dr. Koren to spend time talking with our local business people from different sectors and hear directly their firsthand experience of what they've gone through over the last 6 months. So I strongly advocate that we send a letter, or if there's a suggestion for a language change, certainly open for that. But I would move approval of the letter.
Is there a second to that? Okay, hearing none, we'll continue our discussion. And
Mr. Chair?
Yes, Supervisor Brown.
I certainly hear what Supervisor McCowan is saying, because I have the concerns as well. But I believe the statement made by Supervisor Williams in supporting our public health officer, especially just being sworn in earlier today, I am willing to do that. And every supervisor can write their own personal letters to the governor and be heard. So, but I have to stand behind our new public health officer, and maybe there is some type of a letter we can write, but I would sure urge Supervisor McCowan to send his letter in to the governor on his own second district letterhead. Thank you.
Okay, and I was going to add,
Chair.
When I talked to Dr. Koren, we have discussed about having the state do some kind of request that the state do research, provide data about differences between urban versus rural counties and what they're seeing, and if they have that data, to share it with us. And so I would support Supervisor Williams trying to create something. I think that's the idea that Supervisor Williams was talking about too. And I would hope that Supervisor Williams could take some of those ideas that Supervisor McCowan has written about and also collaborate with the public health officer to create something that we can all agree on.
I think we all want to affect change in the same way. It's a question of how to be effective. And if it appears that we're pushing an agenda for political reasons, I don't know that the state will bend policy. Whereas if we have the support of somebody who's studied, public health and epidemiology, who says some of these restrictions don't make sense based on, and then provide some of that the data, I think we have a better shot at it. So we already have one letter that the state has not responded to. I don't know if piling on a second is the best.
Mr. Chair?
Yes, Supervisor Brown.
Thank you. And I'm sure I'll hear more on Thursday, but a lot of counties, whether you're rural, urban, suburban, no matter your size, are having a tough time calculating how you move up and down the tiers. What is your count? It's 3 weeks here, 3 weeks there. Very difficult to understand. So if there is a letter written, I hope that's included in the correspondence.
Chair Haschak, may I ask Supervisor Brown if in her participation with the state associations, has there been any effort that we should be joining, whether the rural counties or CSAC?
Not at this point, but there is a lot of frustration Certainly, you saw early on Yuba and Sutter step out and disobey the governor's mandates and the health order, state health order. And they're right with us in the highest tier. I think it's, you look at counties like Lassen, their outbreak was in 2 prisons. And, you know, that was the state's doing in transferring of prisoners. So, you know, you do hear a lot among the counties, but everyone's a little bit different. The number of counties in the Sierras where people are buying homes now is through the roof, but the people that live there are very nervous because what are people bringing? So, you know, there's a lot of different feelings throughout the state, and it doesn't matter rural, suburban, or urban county, a lot of unrest.
Well,
but no initiative.
With Supervisor Williams' question, Supervisor Brown, do you think that we could be sending this communication asking for greater data with the urban rural split, you know, kind of what kind of discrepancies there are there that should be researched? Would that go to RCRC?
Well, I think probably both of our associations. CSAC has been the one that's very involved and constantly on this with Cal OES, the California Department of Public Health, each step of the way. So it would probably be CSAC. That's my meeting on Thursday. So we'll see what's said about the new tier system and people trying to figure it out. I certainly will report back to everyone, and I can report directly to Supervisor Williams to answer his question.
And could you raise our concern about lack of data?
I'm sorry, I didn't hear this.
Could you raise our concern about request for data?
Yes, very much so.
Okay,
I've got Supervisor McCowan's letter right here.
Okay. Supervisor McCowan.
Thank you, Mr. Chair. Well, I understand the concern about taking an action that doesn't have the support of the health officer. However, all 5 of us were elected by the public to represent the public interest, and our local business people are getting killed. Nobody was prepared to be shut down or severely restricted for going on 6 months now. It's not sustainable. We're losing more businesses with every passing week. Further delay in strongly advocating for a return to local control or show us the data. I believe the data doesn't exist. The governor cites data and science by referring to it, but I don't believe there's any data bank or there's any scientific analysis that says public health is protected by prohibiting restaurants from serving the public inside, but liquor stores can operate till 2 a.m. You know, that's maybe not the best example, but there's numerous examples of the inconsistencies in the approach that we are taking to this following the state mandates. One other item that I hope the health officer will revisit, this board was told over 2 months ago that the orders, which have grown increasingly long, cumbersome, and incomprehensible and self-contradictory and inconsistent, would actually be revised and would be shortened. And instead, when the new order came out, it had grown longer still, and they grow longer with every passing iteration. So I think serious thought needs to be given to streamlining the order to make it more understandable and clearer. It probably would also reduce the pressure on the call center. But I'll come back to my main point. We are failing the public by not standing with them in asking that the governor relax his draconian imposition without data, without science, and instead have the California Department of Public Health work in a collaborative manner with our local health officer so that we can dial it in that we're restricting those activities that are increasing risk, but we are not needlessly driving people into bankruptcy or underground. And I think we all know it's occurring that if a tattoo artist is unable to operate legally in their studio, there are those that will be operating illegally in a back room or in someone's home. They will not be in a controlled environment. They will not have control of the sanitation. We're creating, unfair business practices in that people who adhere to the rules are losing their business, and other people are acting in ways that endanger public health. And it's being driven on them by the state because the restrictions are unreasonable. I heard 3 of my colleagues speak in support. In fact, Supervisor Williams began the discussion with a very strong call for the state either providing the data or backing away, was how I took it. And I heard, again, a total of 4 of us at least support asking the state to revise their one-size-fits-all. And it's just very disappointing that we're not taking a strong stand on this. And I will point out the public health officer does work for us. He does have extraordinary powers in a public health emergency, but this kind of merges the line between public health policy and public policy. And I do not think the governor is striking the correct balance. And I think it's obvious to virtually everyone. Thank you.
Okay, thank you. All right. And I just like to say, the one size fits all, we've heard that quite a bit, but, I see this tiered system as trying to accommodate different counties. Unfortunately, we're in the really most stringent, tier right now, the purple. So anyway, since we don't have a motion to send this letter, I think that Supervisor McCowan should send it on his own as the 2nd district supervisor, and that if we can continue this discussion in the future, and we'll leave it at that.
Chair Haschak, I have a concern about waiting 3 weeks. We have businesses that may not be around in 3 weeks. I'm also concerned that if we act without our public health officer, the state will simply ask our public health officer, do you support this? And if he says, no, this is the Board of Supervisors and there's a divergence, we're not going to be effective at shifting state policy. And so I support the unification, but I don't want to wait 3 weeks. Are there any ideas on the table?
Well, Supervisor Williams, just like we did with a letter about the salons, you and I could work on it with the public health officer and craft something that we could send this request for additional data.
I would support that with a target of
move
out by end of week.
Okay. Supervisor Brown,
I'll make the motion to approve you, Mr. Chair, and Supervisor Williams to work with our public health officer on crafting a letter and being able to send it without the board going over it and receiving direct approval.
Second.
Okay, any further discussion? All right, so Deputy Clerk, could you conduct a roll call vote?
Yes, just one moment.
Chair Hashjack, if I can make one comment before we move on, I just want to say that that there have been counties up and down the state whose supervisors have sent letters that have been contradictory to what the governor's office has stated. I just want to hope that the letter that if you're going to send a letter, and Supervisor McCowan is on his own, my understanding, so that's fine. But if you're going to write a letter from the board, if you could just be careful with the language, because the governor's office has been real clear on the funding, that any county, moving forward with this new tier process too, that any county that is not complying with the state regulations, that their funding could be impacted. We know that there is a lot of money that has gone into this COVID response, and that is for the public that we've done that. So I'm just respectfully requesting that as you draft something, that you just please proceed with caution. We don't want to be one of those counties that has had their funding threatened. That's my only comment. So thank you.
How about if we run it by Dr. Corrin, CEO Angelo, and County Counsel Curtis before sending it?
We could do that expeditiously so we do not hold you up, Supervisor Williams and Chair Hashak. I really appreciate that. Thank you. Obviously my office supports what you want to do. I just want to make sure that there's no word in there that is concerning to the state. So thank you.
Very good.
Chair
Deputy, could you conduct a roll call vote?
Chair Hashak.
Yes, Supervisor Brown.
I just want to thank CEO Angelo for bringing that up, because that's very true and that's what he has said. So thank you.
Okay, we're going to conduct the roll call vote now.
Okay, I have a motion from Supervisor Brown, seconded by Supervisor Williams. And I have a roll call vote.
Chair.
Supervisor Jurdy?
Yes.
Supervisor Brown?
Yes.
Supervisor Williams?
Yes.
Supervisor McCowan?
He's on mute.
No, he's not.
Oh.
Well, actually, I had been trying to get recognized and the chair chose not to recognize me. I'll have a comment after the vote if you will allow it. And I do vote no.
Okay, and Supervisor Hashtak?
Yes.
The motion carries with Supervisor McCowan dissenting.
All right, very good. Thank you for that discussion. And so with that,
Mr. Chair.
Supervisor McCowan.
Thank you, sir. I don't know that I have any clarity on what the letter will say. As to the comments of being careful about language, if anyone read the letter that I drafted for August 18th, or the letter that I read today, I think you would see the language is very temperate. It's complimentary to the governor, and yet it does make the points that I believe need to be made. So it'll be interesting to see what letter comes forward, but it's a huge disappointment that we can't see our way clear to take a strong stand in support of our local small businesses. During the time that I've been on the board,
Supervisor McCowan,
a huge issue has been economic development. All go down the drain. It's very disappointing. Thank you.
Supervisor McCowan. Okay, we appreciate your comments. Okay, so with that, we are going to adjourn the meeting at 5:08. All right, thank you, everyone, and stay safe. Okay.